All right.
Yep. And
All
we are
right.
good to go.
Good. Thanks, Gabby. Good morning, everyone, and welcome to this April 24th, 2024 meeting of the Oregon Early Learning Council. Glad to have each of you with us today, and I will ask Gabby to please call the roll.
Yeah, and Katie Brooks is joining us a little bit later. Peter Buckley. There you go. Barry Ford.
Here.
Elizabeth Farrar Campbell.
Here.
Robin Hill Dunbar.
Here.
Dr. Peg Miller.
Here.
Subin O.
Here.
Also, Ruby Ramirez is joining late. Marie Simons.
Here.
And Alyssa Chatterjee. Great. And then all other agency directors are excused from today's meeting. So we will just have Alyssa joining us today.
All right. Thanks, Gabby. So exciting agenda once again. As you know, we are focused on DELC today and have tried to put an agenda together that's going to give us a chance to really have a conversation with DELC staff, both on their strategic plan and also obviously on the suspension expulsion prevention program. So I want to thank Alyssa and her staff for allocating this amount of time for these topics and also all of the prep that went into giving us materials so that we'd have some background before we go into this conversation today. So with that, I will turn it over to Alyssa. And I know several of us have been involved in some of the input already on the strategic plan. So this is not totally new territory, I think, for most of us. But Alyssa, we're excited to hear the update.
Thanks, Sue. Good morning, everyone. Yes, and I'll say at the outset too, and you'll hopefully have noticed this in your materials, but the start of this was Raise Up Oregon. You all have charted a course for the next 5 years for the early childhood system. And while I think we counted over 200 responsibilities for DELC, you won't see all of them listed as we really took that kind of ambitious yet achievable lens. It was our foundational starting point so that we could maintain alignment there. So today we wanted to just kind of get you all up to speed on this plan. This is a requirement of all state agencies that the governor has set in her agency expectations. So any agency that does not currently have a strategic plan has to have one by June 1st of this year. Agencies who have had a plan have to have updates made later on. But as a new agency, we did not have a strategic plan and we never actually even had one as the Early Learning Division. And so this has been a really wonderful opportunity to start strong as an agency and really set our intentions and name the vision underneath Raise Up Oregon for the early learning and care sector, and to be a good foundation for our potential budget and legislative requests, which Kate will get into in a little bit later today. So with that, I will hand things over to David to talk about how we started developing this plan. Oh, do you want me to share the slides? Sorry, Gabby, do you want to share?
No.
Or do you want me to share screen?
I have them pulled up.
Okay, perfect.
All right, welcome, David.
Morning, everyone. Just want to make sure I wasn't still on mute because that's how I normally start any conversation. And thank you for having this, giving us this opportunity to share the work on the strategic plan. I know some of you have already been involved in conversations around the plan. As Alyssa's already mentioned, Raise Up Oregon was a real starting point for the plan. And Gabby, could you go to the next slide? Oh, one more. Thank you. We really wanted to make sure that we were leveraging existing work, in particular, existing conversations, engagements that have taken place over the last year and a half with families, with providers, with community partners. One of the things that we often hear, and I know other agencies often hear is, haven't you already asked us some of these same questions? So we really wanted to make sure that we were leveraging the resources and time that folks already gave us. So that included the work that the early learning hubs had done in engaging families and community partners as part of Raise Up Oregon, what we heard when we were working on DELC's mission, vision, value statement. Also really leveraging the consultation with the tribes that had gone into the development of Raise Up Oregon, looking back also at our own DELC staff engagement surveys and what we had already been hearing from staff, is also wanting to make sure that DELC's DEI action plan was threaded throughout the work and the document. So as part of that, as part of our initial work, we ended up with 8 goals, 29 objectives, and 122 strategies. And then what we also did is, in addition to trying to boil that down to really have a manageable document, is really focus on, I think, what Alyssa always refers to as that simultaneous goal of wanting this plan to be both ambitious, but also realistic. And so part of that analysis that we also did at that stage in the development plan is looking at what is the appropriate balance between existing commitments and existing bodies of work and what's new in the plan. We know that in order to reach some of the goals that are in Raise Up Oregon, and that you'll also see in this plan, that new resources are needed, particularly to expand access to programs, right? And that's really a conversation with the legislature. But we also knew that if every single strategy and objective in the plan depended upon the legislature putting in additional funding, that's not a realistic plan. We also wanted to make sure that, knowing that this is a 5-year plan, were strategies really distributed over that time. So we're not saying that everything will get completed in year 1. And then we also looked at existing staff capacity. What parts of the plan do we feel we really have the existing resources and staff to achieve those goals? But it also acknowledged that there's some really important work that we've heard from you, we've heard from the community, we've heard from families, that we would really have to grow our capacity to accomplish. Next slide. So in addition to leveraging existing documents, existing partner and family engagement, though, we also did want to make sure that families, providers, community, and also DELC's own staff were involved in this process. So this engagement started in 2023. We're still getting feedback, and I think, Gabby, I don't know if you want to talk at some point a little bit about what's up on the web as well in terms of the feedback. But partners throughout Oregon, community engagement sessions were offered during the day and in the evening. And to date, we've had 14 meetings with families, providers, and other partners. Nearly 400 families have participated, and in addition, another 420 partners, including childcare providers, advocates, have also given input, as well as members of the DELC team. And you can see on the top some of those key sort of reflection questions that we asked people as part of that partnership, as part of that engagement. Also, I want to give a shout out to Gabby and Karina, who really led this work and just did a wonderful job in making sure that engagement happened and happened broadly. Next slide. So I won't read everything on this slide, but these are some of the key themes that we heard throughout the engagements that I hope you'll see threaded throughout the content of the plan. I don't think a lot of this should be shocking to you, that we know that there's a need for increased access to affordable early learning care across the state, the importance of supporting workforce. We also did hear about the importance of increasing customer service, in really making sure that we as DELC are having strong foundations, so like things like grants can get out in a timely fashion. One thing I'll say that was really striking as the team was analyzing all the feedback is how much consistency there was across from families, from providers, from community partners, but also from what we were hearing from our own internal team, both about priorities and needs of families and communities. Next slide.
Thanks, David. So as we get into the plan, I also want to name, we had an advisory committee that the governor's office was a part of, and we had representatives from the CCRNRs as well as the hubs, and want to thank Sue and Subin for participating in that as well, to kind of do a preliminary review of this plan and recognizing it's a lot of information. And even as we've tried to distill it down, there's a lot of work in here. And to David's point, we've tried to do that analysis of our capacity, also looking at what of this was currently planned, and planned does not mean we've thought that would be a good idea. Planned actually means you have a work plan, you have, dedicated time outlined to do the work, and what is completely new work, and trying to strike that balance. And so what we wanted to do with you all today is walk through these goals and kind of keep some reflective questions in mind, and spend a little bit of time getting feedback and your input on this as we get closer to that June 1st date. Our goal really will be to kind of be pencils down by mid-May, so that we can get this cleaned up and designed and ready to deliver to the governor's office by June 1st. So if you go to the next slide, Gabby, these are just some questions that we'd asked the advisory group as well. And you're not limited to just these questions, but just some prompts to think about what strategies, so really looking at that detailed level, you see as the highest priority within each goal area. What role do you all want to see yourselves playing in the dissemination and implementation of our strategic plan specifically, and those connections to Raise Up Oregon? And any thoughts you have about how you would like us to report out on progress, whether that's to you all as the council and recognizing that balance you're trying to strike as a systems council and not just for DELC, and how you want us to report out to the public, and thoughts about that, and any other feedback you have or reflections you have about the strategies, goals, and objectives themselves. Next slide. One of the things we also did, thanks Gabby, is we looked at some of the governor's office foundations that she has set for all agencies, and some of the priorities we've heard from her when it comes to early learning in particular. And so you can see that each of these goals connects at some level with at least one of the governor's office foundations. So those foundations are customer service, which she has set as an expectation for all agencies. We know the governor has been interested in prenatal to 2 strategies in particular, and really strengthening that. We've heard in contrast to creating new things, really looking at how we can improve coordination and the quality of existing services, not just adding new types of services, that there's a need for potential expansion, particularly as we look at some of these ambitious goals in terms of access, and that we need to be recruiting, retaining, and supporting the early childhood educator workforce. So these are the overarching frames that we kept in mind in developing these goals, objectives, and strategies. And so we also took a similar structure to Raise Up Oregon. So goals, objectives, and strategies, really trying to kind of match up with the way Raise Up Oregon articulated the work as well. Next slide, Gabby. One other reflection, just looking at how the Raise Up Oregon work has evolved and some of the lessons learned from that process, we are including all of DELC's programs and supports in our plan. So that means every program we administer, it means all of the services we offer, like licensing and compliance, inclusive partners, the regional services being offered through CCRNRs and hubs, but we don't want to name 15 things in every goal, objective, and strategy. So rather than having a series of commas and parenthetical references, we will be referring to DELC, to core programs, and we're defining in the plan everybody that's included in core programs. So moving away from being named individually and recognizing some of the discomfort that caused in community by folks feeling that they weren't represented as well, or some were and others weren't, and really just leveling that playing field and being really clear about our intentions when we speak of our workforce and we speak about the programs and services that DELC is offering. So with all of that grounding, I would love to get into the first goal with you all, which is access. This is one of our longer goals. So every goal we've tried to have like a 1 or 2 word roll up to kind of capture what it's trying to accomplish. And in this case, it's access, in that all families have access to high quality, which as the council has defined means culturally responsive, inclusive, and developmentally appropriate, and affordable early in care that meets their needs. We've also tried to organize these in a way that kind of builds off of each other. So trying to think about what would kind of have to happen first for the subsequent work to occur. So I'm not going to read this super dense slide. I'll give you all a minute or 2 to kind of digest it. And happy to answer any questions, or if there's anything that jumps out at you. This goal will have 2 slides. So really focusing on that access to care.
And if it's okay, Alyssa, I just want to add that, even if you just look at the first sentence in objective 1, I think that's an example of what Alyssa was referring to. So when we say core programs here, that will be identified in the plan of, all of the programs that DELC administers. So, but again, so that that's able to fit on 1 line rather than 5 or 6 lines.
Okay, we'll go to the next slide. That works for folks. So this is a continuation of the same goal. As we kind of went through to consolidate, some of this was trying to roll things up under similar goals rather than creating multiples that are working towards the same aim. So this again is sort of building off of that work and gets a little bit more into the infrastructure and administration of the programs themselves.
So, excuse me. So Alyssa, quick question. One of the questions you are asking us to think about is prioritizing. And I'm wondering, have you and your staff set priorities among these 100 or whatever the number is of the strategies, or at least priorities among the objectives?
What we've done is looked at kind of what's planned versus new work. So anything that's planned is kind of earlier in the queue. What would be really helpful, the other term we've used besides priority is urgency. So if there's a body of work as we think about what's new that we have to direct our limited capacity towards, what really emerges that you want to make sure in the next 2 years DELC is focusing on. And we'll kind of look at whether that aligns with planned work, or if that's a body of work that kind of falls into new. That means great, we're going to dedicate some capacity, which means some of these other new bodies of work are kind of backburnered. Or if it's a really, really big lift, it could be that some of the planned work is backburnered if the council really feels like this is more critical to address. So we've got the analysis of the how, but really would love your input on the what.
Okay, thanks. And council, I think, this is meant to be a conversation. So I think as Alyssa and David go through these slides, feel free to jump in. Marie, did you have a?
Yes, I do. Thanks.
Yeah.
Alyssa, on objective 1.6, and 1.6A in particular, I'm curious how you all are thinking about develop and implement a plan to increase the availability reading through that. What does that look like? How have you been thinking about going about that, and what elements are part of that development?
Yeah, so especially now that we have the ERDC program under DELC, it's a real opportunity to look at the variety of programs and services we offer and really start to think about how to use those comprehensively. Where are they building off of each other and folks are leveraging multiple funding streams? Where could they build off of each other more effectively or efficiently? Are there administrative barriers we could reduce to kind of help with that coordination? And then what are the gaps? And so really looking at that analysis of create where there's consistency, where there's overlap in terms of eligible families, the partners that are accessing the services, efficiencies that we can identify, those gaps that are missing to inform future budget requests, or to inform program administration changes that we could make to help get at those gaps. And we were really intentional about the verbs we used, keeping that ambitious and achievable frame in mind. One of the other things we did is an earlier version when we had the 122 strategies, is we were naming like step 1, step 2, step 3, and what we did instead to make it more manageable and digestible is roll up. And so this is an example where to develop and implement a plan has many steps, and this is sort of articulating the overarching strategy of a plan. So many of these have will require an entire work plan to be developed alongside of them. But that's some of the preliminary thinking, and feels really connected, this one in particular, with the vision and intention that the legislature had in creating DELC and moving the programs together that they did.
And then, sorry, just a quick follow-up. I see 2 other people with their hands, but I do know that, I think I've referenced before the 2020 plan that was created, a part of the then the governor's task force, as well as other documentations that's out there. So I'm sort of hopeful that you all have recognized that work, and you're not starting from, it's not starting from zero. It's definitely starting from, a goalpost a little bit farther down the road. But when I think of this goal in particular, it makes me think about, I think we often talk about childcare as, ERDC is like a single child reimbursement, and Baby Promise is a single child fund, et cetera. But business exists in a group, and we have those groups set through our licensing. So I guess I would really encourage the DELC to think about the programs that we have impacting businesses, because they are groups of children, and ensuring the health of the business and the group, and not and keeping in mind each individual. But a business can't exist if it just has one child.
Yeah, absolutely. And we are, so much of what came out of that legislative work group has been implemented, but we are looking at how we can build off of it, especially now that some of those recommendations, like the creation of DELC, have been realized. And you'll see as we get further down, I mean, we have really clear responsibilities from the feds around health and safety through licensure that we can't deviate from. But you'll see a lot, there's a whole workforce component in here that we'll get to later on in the plan as well, that really starts to dig into how are those wraparound supports being created, and what other ways can we really support childcare programs as businesses without retreating from our federal responsibilities around health and safety of kids in care.
And, I would say that part of also this objective, and I think particularly why we have some of that language of a plan here is, I think as to what you were saying, Marie, building the childcare supply requires multiple strategies, and some of that is how we leverage licensing. What are some of the direct business supports and TA that our R&Rs are also capable of providing? How do we leverage our direct public funding from ERDC, but also our other programs? And then also, how do we work with other agencies to address those barriers? And I think part of the plan part is also an internal recognition that we do also have a lot of these strategies in place across different pieces of DELC, and that we also actually have some additional work to make sure that those strategies are being really brought together in a concerted way, with a focus on that goal of maintaining, building, increasing supply of childcare.
Okay, thanks, David and Melissa, and good questions, Marie. Peter.
So I'm biased, of course, but I would, I'm looking at objective 1.5, and I would make that objective 1.1, and I would rephrase it to it's not just mitigating suspension expulsion, but I think the heart of the Oregon Early Childhood Inclusion Initiative is how do we have a system where every child and every family is included? And I think that if that was our first objective, that would also address the workforce issue. Because if providers and staff members have the infrastructure they need and the support they need to provide services to every child and every family, I think the rest of these objectives fall underneath that. That's just my bias on it. I really think that it's not just mitigating suspension expulsion, but it's how do we fully implement the inclusion initiative so every child and every family is welcome in a way that supports the workforce. If we can solve that, I think a lot of these other issues start to get solved themselves as part of that. That's just my bias.
Thanks, Peter. That's really helpful. We can definitely make sure we're looking at the order and naming that inclusion component as part of that goal. It's a really good call out.
Yeah, thanks, Peter. Liz.
Hi, good morning. I just wanted to applaud. I really like 1.4B, the blending of funds. I think for the small providers, I know in my little town in Condon, it is an actual license center, which is rare in a very rural community, but they are blending 4 or 5 different programs funding. And it is the fact that each has their own teacher qualifications, each has its own, it is a mess to try to navigate for a director who is also, trying to supervise staff and run a center and occasionally be in the classroom to give teachers breaks. And so I think the more that we can do the work at the state level so that locally it's as seamless as possible and there's as few deviations in terms of standards as so it's consistent because I think particularly in I'm thinking of Condon Early Learning Center, which is the one that my daughter goes to. As soon as they've got certain qualification or certain requirements because they have ERDC and just a regular licensing, but as soon as Preschool Promise dollars touch their funding streams, that's a whole different level. And for them, they don't have a whole classroom of Preschool Promise. They maybe only have 4 or 5 kiddos out of a 18 classroom. And so trying to blend that, I think, is real smart, and I think it will be very helpful for especially the local or smaller providers that are trying to blend multiple funding streams at a local level.
Thanks, Liz. That's really helpful feedback.
Yeah, thanks, Liz. Robin.
Thank you. I think I might be building on an agreement with Peter in terms of the importance of Objective 1.5 and maybe raising that in a way if we support the workforce and all of the new work, that will help a lot of the other things that we're trying to do. So when I think about prioritizing, that's really hard to do. There's a lot that you all know about prioritizing that I might not know, but when I think about increasing availability and adding programming, I think let's make sure and support what we have in all of the ways, because we may be losing workforce because of the lack of support. And so I think I love that it's in here, that you have the intention. Sort of part of that 1.5 is when I see 1.6C, collaborate with Business Oregon, it makes me wonder about naming other collaborations in Objective 1.5, because I know that we're going to see presentations later that talk about all of the important partners that will support the workforce. And so if it's named the specific partners that need to be collaborated with to make it successful to support the workforce, the inclusion partners, et cetera, that might make a stronger objective or strategy. And I'll pause there to make sure there's lots of hands up. But thank you.
Thanks, Robin. Yeah, we can definitely take a look at that and make sure we're consistent. Are there good other places to call out? Thanks for that.
Thank you, Robin. Subin.
2 things. One quick one, 1.5.d. I know it's easy to create a laundry list of professional development supports in many areas, and it names specifically anti-bias. One of the things that came up in the suspension expulsion prevention program advisory group is developmentally appropriate practice being of critical importance, in that sometimes I'm not saying all the time, but sometimes behavior issues come up because the routines or schedules or environment are not reflecting the new research on what is good for young children. So that's one thing. And then the other thing is, I've had the benefit of looking across all of the objectives and strategies, in a smaller group. And so many of the objectives say develop and implement a plan. And that development of a plan requires time, and there's a certain skill set that is useful in developing a plan. And something that I think would benefit the council is having some sense of where we are in as far as these plans that are in development, like looking at it over time, I guess is what I'm trying to say.
Yep.
Right? Like, what is due when are we going to look at this plan or that plan? And we can't always go into depth into all the plans. So I hate to make this comment because it creates work for people. I know what it feels like, but I would benefit from like an executive summary of sorts, right? That kind of highlights how these things might fit together. And so I just feel that when we're developing so many different plans and so many things are in that startup phase, it also has implications for organizationally. You might be shifting people around who have that skill set of developing and implementing plans.
Yeah, thanks, Subin. We for our timelines and just capacity, we don't plan to have kind of the baked in work plans as part of the strategic plan we're turning in June 1, but we are planning on having a web page and really getting in, since this is a 5-year plan, being able to break down more clearly what is the work of year 1, year 2. And that's why we wanted to have this conversation with you all, to help us kind of refine that so that we can allocate that capacity and our internal subject matter expertise. So would love to keep talking with the council about what you ideally would like to see on that webpage, and that kind of feedback, Subin, about what resources, so that the council can kind of discern where you all want to focus. So that's really helpful. And more to come. Would love to keep talking about what that looks like. We're working right now on how we can identify the metrics for each of these goals, recognizing that each of these strategies could also have their own metrics, some of which we have good data on, some of which we don't. So that'll be, I think, another place where we'll keep evolving and want to be engaging the council in developing that after the plan is done.
Okay, thanks. Thanks, Alyssa. I think this conversation is going to be very instrumental as we look ahead to October and our fall retreat, and just seeing how we want to set that up so that it's most beneficial for the council's understanding, but also to support DELC and our other agency partners as we try to roll out this early childhood system in Oregon. So I'm sure everybody's taking lots of notes at this point. Marie.
Thanks, Sue. I have another question just in general, Alyssa. I know a little bit later, there's one pager in the packet that talked about getting aligned and sharing the vision for hubs and DELC and ELC, et cetera. And I just wondered at what level that the hubs and the CCRNRs were engaged in this work. I think you mentioned it earlier, but I'm curious about that. And then what expectation do you all have in terms of the adoption of these objectives and tasks, et cetera, for the hubs and CCRNRs who are really implementing a lot of this work?
Yeah, so we the hubs and CCRNR directors have been engaged throughout this process, both by leveraging previous input we've gotten through surveys, through DELC design and implementation, and specifically about the plan. We also, our advisory committee included representatives from the hubs and the CCRNRs that their associations named to participate in that. There's I mean, this is Delk's plan. And while the hubs and CCRNRs will have responsibilities, there is so much that we have to do first before the hubs and CCRNRs can kind of go forth. And so what we'll be doing after June 1st is really looking at our internal work plans and then working with the hubs and CCRNRs to say, here's what you can expect from us. This is what we need from you. It dovetails really nicely with the work that we're doing with Build around hubs in particular, in being able to really coalesce around those core services and responsibilities so that they don't continue to be this catch-all, like the solution to everything, which it feels like this kind of the space that they've been in and what triggered this process. So I mean, this is Delk's plan. The CCRNRs and hubs are a critical part of the work that we do and the sector itself. But a lot of this is going to lie with Delk first before we can ask hubs or CCRNRs to move forward. And we'll be bringing them along in that process, both in how we're developing our work plans and what they can expect from that.
Right. Yeah, the sequencing of all of this is going to be a huge challenge, obviously. All right, well, let's move on to goal 2. Goal 2 out of what, 6, I think.
Yeah, we're getting there. This one's a lot shorter. So the governor is also requiring that every agency strategic plan has a goal around tribal sovereignty and government-to-government relationship. So we have been working with the Tribal Advisory Committee, who really asked us to look at the input and feedback they provided in the Raise Up Oregon process to inform what our responsibilities would be as one part of that government-to-government relationship. So this is a section that we've really let the tribes take the lead on. Our Tribal Affairs Office has also been working on this, and we're continuing in a formal government-to-government consultation process with each of the 9 federally recognized tribes within Oregon's borders. So this is a goal that may continue to evolve over time as we continue those government-to-government relationships and conversations, but we've really been deferring to the expertise and expectations of the tribes in defining what our goal and objectives and strategies should be for this one.
We're very glad to have the Tribal Advisory Committee, and Alyssa is our real connector there. Any questions or comments from staff on this goal? I think, you know, from my perspective on the council, it's going to be really important that we figure out how does the council also relate to the tribes and tribal sovereignty. I know you're trying to figure it out at a department level, but at some point, I know we're going to want to be engaged and certainly be a partner with the tribes moving forward. So I'll just put that out there from a council perspective. Okay, we'll move on to goal 3 then.
David, take it away.
Thank you. So goal 3 focuses on infants and toddlers. I know Alyssa already mentioned, you know, that this is a priority of the governor's, but I think even beyond that being a priority of the governor, we know that this is an area that there's historically been underinvestment in our youngest children. This is something that we heard from families, from community, from providers, from you as well. And I think we also know that if you don't call out explicitly the needs of infants and toddlers and families with the youngest children, they can get forgotten. So I think that's also why in this section where, you know, in the plan in general, we aimed for parsimony, that work is named in one place and only one place. I would say this is a place where we didn't stick to that rule, because I think we felt very strongly it's not enough to say expand access to early learning and care programs and assume that people will call out infants and toddlers and that'll be a focus. So, you know, a little bit of duplication in the sense that we need to expand core infants and toddler programs. That means access to our home visiting programs. That means expanding Baby Promise. We similarly, you know, Alyssa will next talk about our goals around workforce. And we also know that if you're not calling out explicitly the needs for workforce support around the developmental needs of infants and toddlers, that will get missed. So we felt it really important to call that explicitly, and also really to call out the needs of our youngest children who have developmental delays, what that work looks like, what that collaboration with early intervention in this sphere requires.
Yeah, thanks, David. Barry.
The first thing I want to say, I want to really commend the staff for calling out the needs of infants and toddlers. It is, well, it's, of course, it's the most expensive care that providers offer. It's the most precious time in a baby's life. And so what I'm going to be interested to see is, what systems this goal will lead to, right? I'm intrigued as to how the statewide systems with regard to supports for programs that serve infants and toddlers connect with families in need, how gaps are filled, how you assess where investments need to be made and where connections need to be made as children age and as families have more than one child. So really, one, I think it's really important that you do call out the needs of this group. Thank you.
Really appreciate that. And I think just even going back to the Child Care Desert Report, it really did call out that we know that families are struggling to find care across the state, but it's really with infants and toddlers that the struggle is most intense. We also know that the low ratios that infants and toddlers require also exacerbates the problem of compensation for the field, and that's something that really needs to be tackled as part of that. So I really appreciate that.
Yeah, thanks. Robin.
Thank you. I also really appreciate that this is called out, and I appreciate that home visiting was just mentioned in the slide. I don't see it actually called out specifically, and I'm assuming it might be 3.2A, expanding infant and toddler programs, not just childcare, but in home visiting. Yeah, I just wonder if it's worth saying the array of services, including home visiting and something like that, so that it is expressed. And then you mentioned in 3.1C, achieve a credential, which there's lots of things that could mean. And because Oregon has an infant toddler endorsement, and RMHA supports that, which I know they're named in as a key partner in early childhood mental health. And so I just wonder if it's worth adding credential and/or endorsement, something that just calls it out, since Oregon's so fortunate to have that. So those are my two thoughts on this, but I'm really glad to see infants and toddlers prioritized.
Thank you.
Great. Thanks, Robin, and great suggestions. Marie.
Just again on this 3.1 infants and toddlers, the piece of this one that sort of stood out to me is the compensations are increased portion. And I think as the DELC has rolled that out in the past with programs like Preschool and Baby Promise, there's been sort of an expectation of wage for the business or employer, which I'm in support of increased compensation, but you are putting additional requirements on businesses in terms of what they need to pay their employees. And I guess I go back to, again, how are the systems and the requirements that we're setting up as DELC, how are they impacting businesses? Do we know that requirement is there in terms of the compensation we are providing as the DELC to those businesses in order to provide that care? So just some analysis there that we might need to do in order to look holistically at the business and know what we're expecting of them is achievable.
Thank you for that. And I think as we'll go into the workforce side, you'll see a little bit more discussion of compensation. And, I think part of what we wanted to put in the table that you'll see. I apologize for jumping ahead a little bit. Currently we really have two main policy levers, right, for thinking about compensation. One, we have our publicly funded programs. Are we funding those programs at an adequate level? And in those programs, is there an opportunity to build in compensation levels that we are also committed to funding adequately? We also have our ERDC rates, but I think as you were getting to, that really addresses only a portion of the programs and the workforces that are receiving those public funds. And there's also complications of how you handle those when you're also receiving private pay. So I think that's also a place where you'll see where we explicitly recognize we need a broader portfolio of strategies around compensation than we currently have.
And I'm sorry, one follow-up to that. Would you see, I know we've talked before about the ERDC rates in particular in rural, like, is this where you would see the prioritization of the work around some more equitable rates across Oregon where that work would reside?
Yeah, and I think we allude to them around the transition to the alternative rate methodology as an opportunity there.
Okay, thanks, David. Peter.
Thanks, Sue. This overlaps with workforce too. I was on a Zoom this week with some folks in Eastern Oregon, our colleagues in Eastern Oregon, and talking about they're considering is there a possibility to set up a program. It would be similar to what we have in Department of Human Services, where we have someone who is severely disabled. If there's a family member that can provide care for that person, the state pays for that family member to help take care of that person. They offer training, etc., as needed. And the idea from Eastern Oregon was, would that be possible to have in early childhood, particularly around infant and toddler care? Could we actually develop a program to pay a grandparent or pay an aunt or uncle to help provide infant and toddler care so that a parent can work and continue to make a living? I don't know where that falls in this in terms of whether it should be infant toddlers or workforce, but I think that's a very interesting idea, and we have a model with it in DHS already.
Thanks, Peter. And I think I don't remember if it's in one, but we do have I think it's in 1.2 as we look at eligibility criteria. So we do, ERDC is that, right? Grandmas, aunties can be the ones that are providing childcare. One of the strategies we have is how can we expand or shift eligibility. So in theory, you could raise the income level, and so you're not being cut off at 200%. We could add if there's a high needs child. So I think that's a great suggestion and something we can make sure that was the sort of the intention of 1.2 is that, and how do we leverage ERDC? So that's a great call out and connection point. Yeah,
and great that we have a partner who's doing that, so it could help with the implementation of that.
Mm-hmm.
And I think that gets a little bit to also parts of 3.3B that we also know that when programs have children that have additional needs, how do we think about when we're one of the funders, what's our funding model to be able to provide the additional funding to have appropriate staffing for the level of care that's required in those situations.
Yeah, I mean, obviously this is a very specific example of our partnership with the Department of Education because they oversee the EIC program. So yes, the partnerships are going to be really key. I just want to add my endorsement of having infants and toddlers called out. I think that's one reason, a year ago or 2 years ago, the council appointed a home visiting system committee as our only standing committee, was a way of trying to get focus on infants and toddler prenatal to toddlers, because we knew we had focused so much on preschoolers, and we wanted to get ahead of that, so kids are ready for preschool. So I would just, I guess, endorse what Robin was suggesting, which is that you go ahead and call out home visiting when you look at 3.2.a, knowing that it's one of the council's top priorities and also aligns with what the governor, I believe, is going to be looking for, as well as Representative Reynolds in her Momnibus initiative. So I know you don't want to have to call out all 20 programs or however many are going to be in this 5-page appendix at the top, glossary, but I think it would be wise to try to have home visiting. Right now is only mentioned once in this entire plan. I believe it's under, partnering with OHA. So I would just agree with what Robin was suggesting. Speaking of Robin.
Thank you. I just wanted to broaden possibly the language and say home visiting support, home visiting and an array of parenting supports, because it could be a parent support group. There's a lot of ways home visiting needs to be called out. And I think of our parent education system, OPET, or Oregon Parent Education System that we have in place in Oregon, that has support groups for parents and other kinds of parenting support, so that infant toddler array of services, including home visiting, parenting supports, would be really great to acknowledge in that. Thank you.
Yeah, we'll see how we can weave it in. This relates a little bit to what Kate will talk about with POPs and Ledge Concepts. There is some strategy in naming it the way we have, because the legislature has chosen not to invest in infant toddler services in the traditional sense of care, right? The only way that we're getting it right now is through federal funds or choosing to use our OPK dollars for infant toddler. So there's a balance we're trying to strike of naming this while making sure that in the beginning we're very broad in our definition of those core infant toddler programs. So I just wanted to name two. Like, there was intentionality in naming this the way we did, because we want to put a bright spotlight on, you can't say you care about infants and toddlers and you want to address the childcare desert if you're not willing to invest in infant and toddler care through Baby Promise, through OPK. And we need to keep investing in Healthy Families Oregon. We need to recognize the wraparound supports of OPK and the parenting ed, but those things have had less trouble getting traction with the legislature than infant toddler care itself. So I just wanted to offer that. So not saying no, but just sharing some of the thought behind how we're trying to be strategic with the framing of this and with the intentionality. And I think David mentioned, but for those of you who are familiar with the First Raise Up Oregon, you'll find those baby icons throughout the rest of the plan, bringing those back and naming that this is the section to look at, and that you'll find other strategies where there needs to be an intentional infant toddler focus in implementing that strategy, rather than duplicating it and just adding infant and toddler to the same strategy in a different section. So wanted to make that clear too.
Hey, we'll look forward to seeing those icons back.
Yes, they're coming back.
My favorite icon of all. Okay, let's move on to the easy one, workforce.
So this is another jam-packed one, but only one slide. So making sure that our workforce is diverse, culture responsive, high quality, and well compensated. We're going to be shifting that high quality term. It doesn't feel right to talk about people as high quality. So that term is going to be shifted. And so looking at how we're kind of building off of the investments that the legislature has made so far. And again, coming back to an intentional plan around that and how we plan to really support and grow the workforce. And this is where you'll see some more compensation strategies and more of the professional learning supports work. So I'll let folks digest this one.
Comments on workforce. We talk about this at just about every meeting, I would say.
Melissa, this is Marie, and I just wondered what kind of conversation or opportunity is there for conversation statewide with the workforce investment boards around some of the workforce strategies? And has that already been explored, or is that on your list of opportunities in development?
Yeah, I would say right now it's fairly ad hoc. And so there are some workforce investment boards that we've had conversations with, particularly if they're working very closely with the hub, and there's others that we want to. This is something that we've been looking at a state level. How can we work with HEC? How can we work with the governor's office to be able to make those relationships more intentional? So I think that's something we would fold into some of objective 4.1 at a high level, but that's something that we could look at naming more explicitly, that intentional partnership. Thanks for that, Marie.
Right. I think part of our challenge just as a system builder is identifying all of these various partners who are out there and already making a difference in running programs that definitely have an impact on an early childhood system. Trying to form one. Subin.
So I 4.1.c, it was really insightful hearing from Ben and HEC about how they're going about meeting their priorities and what they've been asked to do, focusing on low unemployment, which is a great goal. And the goal that we're trying to work on is building supply, right? And so putting that, I don't know if it's just a HEC problem, right? How do we get, it's almost like we're asking them to shift a priority, right? Or at least put some attention to what we're trying to do here. So I don't know what the mechanisms or the levers are to have that conversation. I also appreciate that the compensation piece is side by side with that HEC conversation, because sometimes we talk about it as a chicken and egg thing, like we have to build up the compensation in order to work on the pathways. And like, I think it needs to be very clear that this is a parallel track, that both of those things are happening. And I made this comment in the smaller group, is that when we're talking about workforce, for example, when I think about national recommendations, I'm thinking about like, which national recommendations, right? There's multiple workforces that we're talking about here. Is it NAEYC, where are we talking about infant toddler mental health? Are we talking about infant toddler care versus preschool? And there's different competencies and coaches, right? That's another one. I feel like, again, as a council, I feel like we would benefit from something that either visually represents how these different things are being pursued and how they're fitting together, because so much of this is in development. It's conceptual right now.
Thanks, Subin.
Okay, thanks. Yeah, thank you, Subin. Robin.
Thank you. I'm gonna beat the drum, I guess, a lot today about it. I love all of these goals and support that around childcare workforce, and I think about the whole workforce that you have under DELC's roof. So, is home visiting programs, including relief nurseries, healthy families, OPK is probably included in this, but maybe not the other two programs. Just thinking about the compensation of that as well, and also the support of the workforce who are in people's homes and in that critical time of crisis. So I don't know if it fits in another spot of the strategy. I just don't want to leave them out.
Yeah, that's where in the beginning we'll be defining who the workforce is. So when we reference early learning and childcare workforce, that's intended to be inclusive of every workforce that we directly touch. If we don't directly touch them, so if we're talking about the behavioral health workforce, we're talking about doulas, right? Like that's not going to be us, but so that's what we'll put at the top to try to ground folks without naming each of the explicit workforces. But our intention is that those workforces all need compensation addressed, all need access to supports and professional learning.
Okay, thanks, Alyssa. Marie.
Sorry, there, I'm unmuted now. One other thing that just comes to mind when we say workforce, especially in rural, like these are just business owners. So just wanting to make sure that workforce is called out specifically, especially when we talk about compensation and you're talking about the study and establish improved salary scale and core competencies. Like these are the business owners who are doing all of this. They are the workforce and the business owner.
Mm-hmm.
Hey, Liz.
Yeah, so I just wanted to call out on 4.1C. I think I've mentioned this at a previous meeting, but HEC has a program, Oregon Youth Corps, that at least in my county, we sort of revamped that program, and actually we're placing high school students into centers. And so we were using those funding streams. So I wonder if there's a way to not just talk about access to early education or to higher education, but also is there an opportunity to work with HEC on maybe seeing if there's some existing workforce development programs that if they are willing to tweak just a little bit, that they may be able to still meet their core missions of their programs, but also sort of address this need. And I would specifically call out that OIC program because that is something that we've actually, and I think there's another or one or two communities in the state that have actually used those funds in that way. And it's been very successful for us. So
That's great. Thanks, Liz.
Yeah, I remember, Liz, you mentioning that you've used that specifically for early childhood workforce apprenticeships or training. Yeah, good point. Other comments or questions about the workforce goal and objectives?
So I just want to call out Subin's comment in the chat that he just wants to restate in opposition to the term bias management, which is not research-based and infers tolerance of bias as opposed to being against bias and trying to end it.
And we'll,
Okay, thank you. Yeah, I didn't see that. So where does that show up in this goal?
And I think that was actually a update we were planning on making that didn't get into this document. So thanks for calling it out. So.
And we're working with our social equity director on that and what we really mean by bias management and the difference between bias and racism and the recognition of how those two things are handled. So we'll be working on that more deeply, and Subin, we're happy to follow up with you on that and bring in Kofi, our social equity office director, on that and holding space for differing perspectives on that. Sue, I know we're getting short on time. Do you want us to go to the last two?
Yes. Or goal 5.
So goal 5, relationships. And I just want to start by acknowledging that this goal actually captures a few really kind of disparate kinds of concepts in it. So you'll see, as the first objective in this goal really focuses on our commitment to empower, bring to the table, work with families, providers, and community partners so that they are part of the decision-making process, that their voice is informing policy, expanding feedback loops or hearing back from people. You also see on the next slide our commitments around improving communication to the field, to families, making sure that language access is being implemented. And this goal also captures a recognition that DELC is only just one part of an early childhood system, and that to build the early childhood system, that's the vision of Raise Up Oregon, a vision that we all share, that includes partnerships with you. So go back to the previous slide, you'll see under that 5.2a that means collaboration with the council in implementing Raise Up Oregon, but also some of those collaborations that I think have been coming out in the conversation with partner state agencies, whether it's Oregon Department of Human Services, housing around the co-location, Oregon Health Authority around building a home visiting system, and also acknowledging that there's work happening in local communities and municipalities like the Preschool for All in Multnomah, that we need to connect with, and as similar initiatives emerge in other communities, making sure that we're connecting with those as well. So I realize there's a lot that's ended up getting captured under this goal, and that there's sort of different values involved in some of those different objectives under this one goal.
And I know Subin and Sue heard me say this. I also feel like this is one, because it's become a combo. I don't know that the goal statement itself is the best reflection of all the objectives under here. So that's something we're going to keep refining, and would love thoughts and feedback as you all digest that if you have suggestions, but it feels not quite right to me in terms of what it's actually accomplishing.
Okay, well, certainly that goal is one that is the heart of the council. So we appreciate the number of partners who are mentioned there, including us. Let's move on then to goal 6, and then we want to hear from Kate talking about the legislative concepts and POPs.
Yes. So last goal, this one's also on 2 slides, but this is recognizing as a new agency, there's so much foundational work that we need to do just to set up our internal structures in order to meet some of those external goals. So you'll see a lot more of like our operational and internally facing goals here that ranges from things like creating internal policies, processes, and procedures to some of the softer work, like really developing and understanding our culture. This is where the DEI action plan, which is required by the governor, is woven throughout. But this is where you'll see a lot more work with the DEI and affirmative action plans are kind of pullouts that get even more deeply into this, but will be really key components of helping us achieve some of these internal goals. And looking at things like communication. And if you go to the next slide, Gabby, you'll also start to see this building slightly more and more outward facing. And so making sure that we have very clear initiatives that are identified, that we're being transparent, that we have data systems that are accessible to the public, and that it's being used to inform our decision making. So we tried to structure this one as starting super internally focused and kind of building out as the objectives build off of each other to reach this goal about our operational foundations, with that kind of customer service through line of we need those strong foundations in order to best serve folks across the state.
And I think here there was also just an acknowledgement that as a new agency, getting the house in order and building that foundation strong at the beginning is incredibly important. And I think what was interesting is, while this is probably the most internally facing, not exclusively internally facing, but I think the most internally facing of all the goals, it was something that we also heard from our external partners, as well as, how important it is, and actually they're already seeing some of the benefits of having a strong procurement and grants team to get those out quickly, the importance of data. So I just want to both acknowledge that how thinking about this as a new agency, and also some of that connections to some of the external feedback that we heard.
Thanks, David. Thanks, David. Comments or questions, council, on this really internal, the foundations and structure of DELC to support all this work?
Yeah, and Sue, Ruby dropped a comment in the chat about Objective 5.3 and just how it's great to see the intentionality in partnering with local governments, and that being a potential area for council to support given everybody's networks.
I wanted to comment on this goal. I think it's really critical as a new agency that you get your systems right, because the fundamental disappointment, frankly, with government services and partnerships with government agencies is that their processes are either too slow or unresponsive. So I'm glad you're focusing on this as a primary goal.
Peter,
Thanks,
I can
Barry.
add in the chat, hubs and C-STRNRs, are they DELC customers? Yes. I think what we're trying to accomplish here too is also there's a difference in terms of what hubs and CCR&Rs need as a contracted partner versus what a family needs when they call to find out what's going on with their ERDC reimbursement. So trying to span the gamut there, but we would consider hubs and CCR&Rs customers.
And I just want to point out on 6.5, we'll be talking about data later in the meeting this afternoon. So that's critical for assessing how all of us collectively are doing. All right, let's move on then to the legislative concepts and the POPs, and welcome Kate Dennison, our wonderful government affairs manager, whom we've met, I think, once in the past, maybe as a council. But Kate, we appreciate you putting this information together for us, and would love to, yes, have any other comments you want to make, and then see what questions council members may have.
Sure. I don't think I've had the privilege of meeting with this group before, so I'll just quick introduce myself. I'm Kate Dennison. I'm the new I'm the government affairs manager for DELC. I was previously at the Department of Justice for 17 years. I served most recently as the deputy legislative director for Attorney General Ellen Rosenblum. I worked on a host of mostly civil law policy issues. I'm new to the early learning and care policy space. I was a direct care provider for a while in my past life. So I just feel really privileged to be working for DELC in this really important policy area. So it's really nice to meet you today, and thank you so much for your time. I'm just here to preview what we're considering for the 2025 session. Since we're an executive branch agency led by the governor, it's important to note that nothing that I'm going to go over today has been approved yet formally. We're still kind of at the beginning stages of development. I'm going to try to keep things pretty high level so you have time to ask questions and provide feedback. Next slide, please. So this is pretty rudimentary, but state agencies like DELC can seek approval from the governor's office to request LCs or legislative concepts during the odd number year sessions. And these are proposed law changes that get introduced as bills. Policy option packages, or POPs, are budget requests for any new funding, work, or positions that our agency doesn't already have. Next slide. So here's a pretty straightforward slide. As you all know, Governor Kotek has prioritized early learning as part of her agenda. Agency concept and budget development is a collaboration between our agency, the governor's office, and the Department of Administrative Services, CFO. Right now, we're in phase 2 of development. We got clearance to preview our LCs and POPs with community partners, and then we will submit them to the Department of Administrative Services at the end of this month. After that, this will all undergo review by the governor's office and DAS, and then our work to prepare for the 2025 session will continue throughout the summer and fall, and final decisions will be made at the end of the year. Next slide. I'm going to run through some of the LCs that we're considering for 2025. These are really building off the priorities with our strategic plan in mind. We're trying to stick with technical fixes and continuing to focus on the work that we've been charged to do as a new agency. As I already mentioned, these haven't been approved yet, but we will be submitting them at the end of the month for consideration. The first one here is a reintroduction of a bill that did not pass in the 2023 session. House Bill 2872, it would have created the statewide Dolly Parton Imagination Library. We did receive a pot of money to begin that work, but we do need the statutory authority to govern the program. Next slide.
And Kate, on that last one, I just want to mention that what happened last session basically was not that there was actually a lot of support for the Imagination Library in the legislature. They basically just ran out of time to get it through committees.
Yeah. Everybody loves Dolly. I think this hopefully will Our next concept relates to the birth through 5 literacy plan. House Bill 3198, which created the plan, did not grant the Early Learning Council with rulemaking authority to develop a program rule set to implement the plan that meets all of the allowable uses of the funds. So we're distributing them through the Early Childhood Equity Fund and KPI grant programs. This concept would provide you with that rulemaking authority and then create a new grant program that would meet all of the allowable uses of the funds. I don't know if David and Alyssa, if you have anything you would want to add to that. Okay, next slide. So this proposal is a very truly technical proposal that includes 2 concepts, and they're intended to align licensing statutes across all provider types. This bill would allow us to do what we've been doing in a less burdensome way for both DELC and, more importantly, for providers. The first change would allow all providers to seek an exception to a licensing requirement similar to what is already in the statute for registered family providers. It would allow some flexibility, and the provider would still need to show in their request for an exception that they meet the requirement in a different way or that the rule doesn't apply to them. I think the best example with this is if a provider doesn't submit a timely application for a license and they can't get like a sanitation inspection before the license expires. This would allow us to waive that requirement and so that they can get that inspection done and they wouldn't have to shut down the whole facility in the meantime. And then the second change would remove statutory ratios that are provided in the registered family statute. This is the only provider type that lists specific ratios for each age group. The overall cap on the number of children in care would remain the same. This will really allow more flexibility for like infants and toddlers to join siblings in care, for example.
I just want to add one thing on that. So that means that we would be able to put that in rule. So those ratios are in rule already for the other provider types. So we'd be able to put in rule. So that means that we would be able to work with you on those ratio tables. And you guys meet a lot more frequently than the legislature does. So it gives us that flexibility to make those changes.
Thank you, David. The next slide. The measures that created the early childhood suspension and expulsion program didn't give DELC explicit enforcement authority under our licensing authority to enforce the ban. And they didn't give you all rulemaking authority to govern the program or grant any exceptions to the ban. This concept would provide you with rulemaking authority and allow DELC to enforce the ban using our current graduated approach that we use for other licensing violations. The changes that are in this concept are all detailed in the report that we submitted at the beginning of this year. Next slide. In 2021, the legislature passed House Bill 2055, establishing the early learning or the Tribal Early Learning Hub and Tribal Advisory Committee to design the hub. DELC has been working closely with tribal nations through the Tribal Advisory Committee to define the future of that entity and design a tribal early learning plan. We met earlier this month to start the work of pulling together some statutory changes that reflect the tribe's intent, and we'll continue to consult with the tribes as they design their early learning program. Right now, this proposal is a placeholder as we work with them on that process. So stay tuned for more details. Next slide. Here's another placeholder. Basically, this means we don't know whether or not we're going to end up needing the concept or not, and we haven't fleshed out all of the details, but this is one that we are considering. In the 2023 session, the legislature adopted House Bill 2683, that further expanded ERDC eligibility to additional groups, including children and families receiving child welfare and related services by July 1, 2025, and to those receiving homelessness, teen parent, or domestic violence services by July 1, 2027. Depending on the waitlist status, projected caseload scenarios, and budget impact scenarios, as we continue gathering data around ERDC and the waitlist, DELC may not have the capacity to take on additional populations next biennium. So this proposal would just extend out the dates for implementation of those populations by an additional biennium, so 2027 and 2029 respectively. Any questions on the LCs? Okay, I think we can move to the next slide. I'm going to preview some of the budget requests that we're considering for 25. In developing our agency request budget and POPs this year, DELC and other agencies are really working hard to ensure that our agency request budgets are reflective of available resources. And then when the governor submits her governor's requested budget later this year, she also has to keep a balanced budget in mind. So with that framing, I'm just going to preview some of the budget requests we're considering. These are still really high level and undergoing development. So I won't be able to go into a lot of detail, but I'm happy to take questions, and I'll rely on David and Alyssa to kind of fill in any details where necessary. So the next, here we go. We're considering some funding proposals to build capacity in core areas where it's most needed. These are really focused on workforce recruitment, retention, and support. The EC, SEPP, POP would really focus on more regional capacity. CCIF workforce, worth considering expanding business coaches statewide and providing more technical assistance. The House Bill 2991 POP might include evaluation of international degrees and multi-language Set 2 development. Those are some of the ideas that we're considering. All right.
And Kate, I'm sorry to interrupt, but we are just about out of time and need to move on to the SEP presentations.
Okay.
So I apologize for that. As always, we tried to cram a lot into this.
That's fine.
Council members, you've had in our packets the POPs that Kate outlined. So let me just take a couple of minutes to see if there's any part of the POPs that you'd like to ask Kate to address. And we can, I'm sure, invite Kate to come back and join us again. Kate, I apologize that I forgot you hadn't been to the council meeting before. So thank you for your introduction.
And I didn't mean to interrupt you. I was just going to say, feel free to send me questions if you have any questions about the slides.
Super. Thank you, Kate. Any questions, council, on any of the POPs before we switch agenda topics?
I had one question. I saw the Early Learning Council priority placeholders. Totally understand home visiting, system coordination center, early learning hub resourcing. Are there more details around that we could have right now?
Yeah. Do you want me to take that, Kate? So this is a placeholder as we're doing this build work on kind of scoping those core responsibilities, recognizing that there could be additional resources in order to adequately fund what those core services are. So this is what that placeholder would be for.
Okay, good question, Ruby. Any other questions on the POPs?
Well, just on that, Alyssa, is that something where I recognize the political challenges with this in our state, but is that something where we would explore the resurrection of a tax credit to support these hubs?
We wouldn't, as a death. So to Kate's point, part of this challenge, and Robin, this gets to your question in the chat a bit as well, every governor has their own approach for developing the governor's recommended budget and for agencies to develop their agency request budget. And the approach this time is, rather than saying, put everything on the table that you need within reason, you've still got to pass, like the laugh test, and agencies spending the state budget 8 times over. We're really trying to keep this in line with current revenue sources and projected revenue availability, which means you'll likely see us asking for a lot less than you've seen us ask for in the past. And that will be across the board, across all agencies. And this is so that we're also not setting unrealistic expectations for community by thinking if we ask for $210 million for programs and there's not that much funding available, that it's unlikely to be resourced. That being said, there could be other conversations outside of the executive branch exploring things like tax credits or other revenue sources that could then allow us to have conversations about maybe larger scale investments that you may not see in our agency request budget this time around. And so, Robin, kind of to answer your question, in May, April 30 is sort of our next deadline to turn over our list in its current form, and we'll continue to revise that. So happy to share updates in May on what that's looking like. To Kate's point, I know her contact is in the slide deck. If there's something that you want to know, is it captured in our thinking? Let us know. After next week, it's very unlikely we could say, oh, you know what, we forgot, and we actually needed an initiative around this and to request funding. So if there's something you want to find out if it's captured in our thinking, feel free to reach out to Kate, and we're happy to follow up on that.
Great. So I think the answer to, is it Robin wondering, can we get this back in May, is yes, right? Okay. So we'll look forward to seeing you next month, Kate.
Thank you so much.
Thank you very much. All right, Council, and Alyssa and David and Gabby want to thank you for the strategic plan conversation and presentation. Very exciting and obviously very foundational to have a strategic plan for the new agency. So congratulations. And I know there's been hours and hours and hours of community engagement to gather basis for that. So it was not built in a vacuum. Nice going. Let's move then, Council, to our next agenda item. But once again, it's not new to us. We've talked about, I'll just call it SEP, or just to abbreviate this. We've talked about it probably at the last 4 council meetings. And finally, we said, okay, the council's interested in this, so we are going to take time to let John and his staff do sort of a deep dive for us and really be able to have a discussion about what this suspension expulsion prevention program is going to be, what the process for developing it is. We have timelines in our packets, etc. So and lots of time for questions from council members. So John, we will turn it over to you. Welcome.
Thank you. Good morning, Chair Miller and members of the council. For the record, my name is John Reeves. I'm the Professional Learning System Director at the Department of Early Learning and Care. And it is good to be back to share what the latest updates are. There's been a lot of movement and things happening. And so it's a good way for us to be able to give you some updates and have you be able to ask some deeper dive questions and have a dialogue with us. So really appreciate this time. And I just want to recognize and value that you've given us a big amount of time on your schedule today. And Chair Miller's shared with us some additional questions that have come up as you've been reviewing our slides. And we've tried to integrate that into our presentation a little bit to answer some of those. And so we have a revised slide deck that will help articulate some of that and can be available, publicly for people to see. But also we have a Word document where we also just put some of some information in related to some of those questions too, just that can be shared as an addendum also. And so that can be brought forward to the council. But I do want to have a couple of my team members introduce themselves so we can keep the flow of the presentation going and not do introductions mid-stride. So I'll turn it over first to Katrina Miller and then to Andy Bales-Molnar.
Good morning. Hello, Chair Miller, members of the council. It is great to be here with you today. I am Katrina Miller. I'm the infant and early childhood mental health specialist with DELC, and really deep in the weeds with John and Andy and other members of DELC and the professional learning team, thinking about suspension and expulsion, preventing suspension and expulsion. And I was going to say, I will toss it over to Andy.
Good morning, everybody. Good morning, Chair. Lovely to be here. I'm Andy Bales-Molnar, and I am Professional Learning System Specialist on the Professional Learning System Office with John. And I am maybe not as deep in the weeds as Katrina, but mid-weed in a lot of this work. So looking forward to this time together and share a little bit more about some of our planning of how the professional learning system itself is being renegotiated and pointed into a direction to produce further reduction of suspension and expulsion.
Awesome. Welcome, both Katrina and Andy.
All right, thank you. And thanks, Gabby, for pulling up the slides. And next slide, please. And so just real briefly, just wanted to mention what we're covering today. We want to make sure that we're giving you a sense of the work that we're doing and who's doing the work. That our team is continuing to grow, and we're bringing in more internal and external partners into the development of the program, because calling it a program is a little insufficient, because it really is something that requires system and a continuum of supports, and it really is looking at both the things that already exist and what Andy mentioned about sort of repositioning them and having them be a part of some of the solutions to prevent suspension and expulsion, and then also building additional services. But it is going to be something that is rooted in and across sectors within our system, and so isn't, what you would traditionally think about of, it is in the legislation as a program, but it really is some system alignment and system development. And we'll be providing information on the 4 quadrants of what we consider within the scope of the program, including deeper understanding of how it all connects together and how it is also interdependent upon each of the areas of those quadrants. And then towards the end of our time, Dr. Andres Lopez from the Coalition of Communities of Color will join us at around 11 a.m. to give an overview of the important work that his team is doing in conducting the study that is legislatively required on the use of suspension and expulsion, and also prevention of use of those of suspension and expulsion. And so he'll also talk about the work of AB Cultural Drivers, which is a contract within their contract, and they're helping us develop the evaluation components of the early childhood suspension and expulsion prevention program. And we do want to make sure that we leave some time, because we anticipate there's more questions, and really some of that dialogue is easier for us to get to the things that you're wanting to know on a deeper level. So next slide. And just wanted to note, we are showing our internal team here, but this is just the core team. There are so many people that are involved in different aspects of this work that are across our professional learning team, our policy and research team, social equity office, program management offices, childcare licensing division, community system team. So it's a little bit of everybody, depending on the strategies that we're working on. And as we go through the slides, we can also try to identify, I think there were some questions around who some of the leads are on different components. Next slide. And as I mentioned, we have a contract with Coalition of Communities of Color and AB Cultural Drivers, and these are their key team members on this project. We also have recently gotten to an executed contract with our central entity, which is the Oregon Infant Mental Health Association, and they're listing and have listed their team members there. This is very, very recent news. We were working towards that contract over a period of time, and it is now landed. And they're our newest funded partner, and they will be working very closely with each of the regional service providers that will be providing infant and early childhood mental health consultation in the state, and they'll also be helping us with some of the coordination of system supports and those connections, and we'll have more about their role and function as we go along. Next slide. It's always good to be on live and clear your throat multiple times. Doesn't want to clear. So just wanted to mention, we don't have the names of all our advisory committee members here, but just wanted to give you some information about the types of people that are supporting that work and walking alongside us. We have a diverse group of advisory committee members that started with us in November. We have family members that have experienced suspension and expulsion, early care and education providers with a wide range of experience and expertise, individuals that are directly and indirectly a part of the technical assistance system throughout the state, and people who are providing specialized services, including folks from early intervention, early childhood special ed, or mental health consultation, and then other interested community partners. And so each month where the advisory committee will be, it has been discussing and getting kind of up to speed on the program, but also is going to be diving deeper into the development of each of the components of the program with us. They will be advising not just the Department of Early Learning and Care, but Coalition of Communities of Color, AB Cultural Drivers, and the Oregon Infant Mental Health Association as we're building different components of the system. And just as an aside, this last month, or I guess as an example, we brought some self-reflection tools that we've been developing that will help in communities and be provided to local regions so that they can look at developing their local systems of support and how they respond to requests that come from early education programs. And we received some wonderful feedback from the advisory committee, and then we're incorporating that into those tools so that we can then take that on to visit with the early learning hubs and the child care resource and referral programs to get their feedback in May, so that we can then really be thinking about how to support them as they're building their local response systems, moving towards the ban. And so that's just an example of kind of how there's going to be a give and take, a back and forth between some of our local partners and our advisory committee as we're planning out some of the stages of this work. I think next slide, please.
Excuse me, John, I want to just make sure the council is aware that Suben is a member of that advisory committee. So Suben, we appreciate you representing us as well as probably several other hats you wear. But thank you for being a part of that.
I didn't want to single him out after I said I wasn't going to name names, but I really appreciate that you brought it up. And thank you, Suben, for your engagement and participation. And this just wanted to also display that we've had opportunities to hear some critical feedback from our early learning and care programs where they've been able to express their needs and concerns and challenges. At a recent child care provider conference, we were able to gather and hear from multiple child care providers around the difficulties that they've been experiencing and accessing needed supports, financial burdens that they have as it relates to their staff or staffing up as they're supporting children with challenging behaviors. They expressed the safety concerns that they have for other children and staff, and it takes an emotional toll. And it includes, things that they're worried about around their legal liabilities and rising unattainable insurance coverage costs, and worrying about whether the ban will require other things like continuing to work with parents that are extremely hard to work with or that might not be that may be sort of rude or creating an unhealthy environment. And the providers called for state action to really think about how we can better support them in various areas and make sure that we're also communicating what the program is and what it isn't, and so that they aren't, sort of having to jump to conclusions on what is the help going to be and how can they rely upon the resources that will exist. And so I state this just as I'm not trying to diminish the parent component of this or the child's experience in early education programs, but we really want to balance how we're building out this program in a way that it's coordinated so that we're supporting those early educators to be in the right mind frame and space and reducing the stress and the barriers that they have so that they can be in the right space to be responsive to children and families. And so we're hoping that as you hear what we're developing and moving forward on, that we can be thinking about how we can create a responsive system for all parties involved. And I will turn this over to Katrina to continue on the next slide.
Thank you, John. So the purpose of the Early Childhood Suspension and Expulsion Prevention Program comes to us, of course, from the legislation. The legislation tells us that our purpose is to prevent suspension and expulsion and to reduce disparities in the use of suspension and expulsion. Back in September of 2022, the council adopted rules for the program, and in that process we kind of expanded that purpose statement, so to really acknowledge not only suspension and expulsion but other forms of exclusionary discipline, and also to identify if our purpose is to eliminate something, what's the opposite of that? What is it that we're working toward? And so we're working toward inclusion. And so we have intentionally represented both of those in this program statement or program purpose. let me just grab it here. I have the link for anyone who's interested in reading the full rule set. You can find it there. So there's still more in the purpose statement than what is represented on this slide. Let's go to the next slide. So this is a graphic that we use to represent the multiple components of the program. And I want to refer back to what John was just saying about the legislation and the name point to a program, but the root causes of suspension and expulsion are much more complex than any one program can ever hope to address. And so we're really thinking about it from there are programmatic elements and program pieces that we are building, but we're really thinking of it as a systems approach. And this is one piece of that. The next slide will show has even more. But if you notice the little blue line that goes around the outside where it says program approach, that's an important little line there because it helps hold all of those quadrants together. These quadrants are not separate. There's a significant overlap between them, but they also reflect individual pieces of work. So all of these work on all of these is happening all at the same time. And in the coming slides, we'll talk through some of what is happening with each of these quadrants, and we're going to try our best to make it clear which quadrants we're talking about. But do let us know if we need to clarify that more. So let's go to the next one, which is putting that program approach into a larger context. So in addition to thinking about training, technical assistance, mental health consultation, a coordinated system of support, those all are going to exist within DELC's existing infrastructure and other programs and policies. John talked about the number of different people and roles that are involved in this development of this work. And that is intended to represent some of that, as well as the development of data systems and research. But then if we go out another layer, there's all kinds of other factors. We know that food insecurity, housing insecurity, homelessness, medical issues, developmental delays, all are contributing factors to suspension and expulsion. And some of those things are beyond the purview of DELC, or at least not DELC's alone. And so we wanted to kind of represent the context of the program sits in DELC, and DELC sits in the context of larger programs as well. And there's going to be ongoing work over time to address all of these. Like none of these are simple, if only they were. But in ongoing work to engage with our partners at OHA. John and I sit on committees with the OHA. There are multiple members of DELC that are regularly engaged with the Oregon Department of Education, EIECSE, the Oregon Early Childhood Inclusion Initiative. They're members of our team. We have a partnership with HEC, the Higher Education Coordinating Commission. So this is, parts of this are in place and parts of this are to be developed, and we need the partnership of many other people and systems to engage with that fully. So let's go to the next slide.
Katrina,
yeah,
I just wanted to state just real quick that there was a direct question about what was our timeline around developing out those partnerships with other state agencies, and I would just like to say that that's an area that we would love to engage in conversation with the Early Learning Council around, to think about how we do that. Just DELC as one agency, pulling all of those things off is probably a little unrealistic, and we want to make sure that as we're thinking about and partnering with our other state partners, that that we can leverage some of their existing capacity and where they're going with this. But we do not have the sort of the timeline and the approach to mobilize all of those areas of connection as just part of this project. It's really part of our ongoing system development. So just wanted to highlight that that could be a great area for continued discussion with the council.
Thank you, John.
Okay, yeah, excuse me. Thank you, John, for mentioning that, because I think council, we want to, as we listen to and discuss the slides in front of us, to be thoughtful about what role does the council play in this? Can we or should we be playing? Knowing that DELC's the leader, but it's going to take all of our partners actually to be at the table and involved in implementation, development and implementation. So we'll see where the council can play a role.
Thank you. Thank you, Chair Miller. We're grateful for partnership in this work. So this slide, I'm not going to read the details, but this is just a quick overview. It's a non-exhaustive list of the activities that have happened up until this time, really starting back in 2020 and up until we put this through last month, because the remainder of our timelines will focus on this month and forward. But a lot of engagement, a lot of planning, development of rules, development of reports and guidance documents. And we have lots of work groups that are happening, and those are actively happening, actively meeting. With that, let's go to the next slide, and I will toss it to Andy.
Thank you, Katrina, and good morning again. So we're going to dive into some of those different quadrants from the original circle graphic we showed earlier, and thinking about our professional learning system. And I wanted to take a minute and kind of also dig a little bit around how do we define that. And so I think about the work of Donella Meadows, who was an expert in systems thinking and design, and she gives the example of a slinky as a system. And a slinky's been designed to do one specific action. And what she says is the hand that manipulates it suppresses or releases some behaviors that is latent in the structure of the spring. And so we see the relationship between the structure and the behavior, a set of things interconnected in such a way that they produce their own pattern of behavior over time. And so within our early learning professional learning system, it's a system that's already in place, and the suspension, expulsion, reduction work has allowed us to reevaluate and think about the behaviors within our system and the relationship to the structure. Systems produce what they're designed to produce. So if we want a system to produce a reduction of suspension and expulsion as a behavior, then we need to think about what do we want that system structure to look like. And as Katrina mentioned earlier, our purpose is we want a system structure that is moving towards inclusion, towards programs that are welcoming, accessible, and inclusive for children and families, and for the professionals who are dedicating their careers to that work. And so what we're showing here is some of the continuation of the supports of what's in place in our professional learning system currently. I want to point out that the numbers that you see are a point in time, and certainly we know in a system as large as ours, there are going to be small groups of numbers that maybe aren't captured specifically, but it does show that, you know, within our current system of our CCR and our organizations, we have over 70 quality improvement specialists who are working with, we have at least data around 544 early learning care programs. We have expanded around our infant toddler specialists that are also working directly with educators in that space, as well as the expansion over the last few years of additional coaches and 22 quality specialists that are working specifically with Preschool Promise and Baby Promise programs. And then new into the system, we're building in the regional inclusive partner positions into each CCR&Rs, and those are really in action or moving forward now. Those are roles that are being created and I think some regions are already starting to recruit for, and that will help to meet the needs of children who are experiencing disabilities, as well as support the programs around that. And then continuing, like we've said, with the through our regional service providers in this work, building up a more robust workforce around infant and early childhood mental health consultants. Can we get a next slide, please? Yes, John?
I just wanted to state, there was one question from the council around what's the difference between these inclusive partner positions versus mental health consultation roles. And I want to say one of the unique aspects of the Inclusive Partners program is that they have an opportunity when they're going out to do consultation with programs. And if children are eligible for employment-related daycare, there is an opportunity to see if children have a high enough set of needs that they'd be eligible for what's considered the high needs rate. And so there are additional monetary benefits to participating in and working with inclusive partners, depending on the eligibility of children and families. And so it is a distinctly different piece than, say, early intervention, early childhood special ed, or the mental health consultation, but it is a part of the system that, as we expand it, can offer additional resources for those early educators that are working with children. So thanks.
So maybe it's a quick question. I don't know if it's quick. So is the expectation that the CCR&R directors, and they're what, 15? I think maybe, that they're going to be coordinating all of these different staff positions. And they've got a lot of new ones coming in, but they also obviously have a lot of existing staff positions.
I can speak to that, John, unless John, you want to jump in. I think that For some of the staff positions that are put directly into the CCRNRs, definitely within that grant, we do ask that the director is accountable for the overall management of the CCRNR. Some CCRNRs, based on their program, may have additional leadership and supervision. But when I think that one thing that we are continuing to have conversations with the CCRNRs around is, what do they need so that internally within their organizations, the folks who work with them have what they need to be successful employees. And then we will continue to work with different parts of their structure and their roles to offer direct support. So for example, we have Liz Zinter on our staff who works directly with the infant toddler specialists and offers them some additional support. And so I imagine that as we move forward and the inclusive partner positions are put into place, we do have plans to create spaces where they are also engaging with DELC staff and other community partners, whether it's through coordinated and central coordination through the Research Institute, or our partnership with the Early Learning System Initiative, or otherwise known as ELSI at OSU, to provide additional support so that those roles can be successful and see themselves as part of the system and where their work is really impactful.
So just responding to the comment that I think Ruby put in the chat. So how do the 22 positions within the regional service providers connect to the CCRNRs?
We will address a little bit of that a little bit farther down in the presentation. Would it be okay to save it till then? And we actually have a list of the regional service providers.
Okay, I think a thread that's going to go through questions from council is, and Alyssa, this may be for you as much as for John, how are you going to pull all of these threads together? I mean, we're talking about so many new positions, so many new responsibilities, and how some of them are, at the DELC level, and a lot of them are at the CCRNR and regional service provider regional level. So how is this really going to be held together? But if we're getting to that later, good, that'll be great. So I'll let you continue.
Thank you, Chair Miller. So moving on, we wanted to share some of the focuses from each of the quadrants and the activities. And as Katrina mentioned earlier, we see the quadrants as interconnected pieces of the system that are both influencing and being influenced by each other. So the training and technical assistance, when we say those words, we're really talking about the umbrella of professional development. So it could include training hours, it could include implementation supports, which when we're talking about implementation supports, we're thinking about how are programs being supported to take what they're learning in training and then put it into practice. So that could include consultation or coaching. And so we do have some timelines, like we said, that we're going to run through. And I do want to just respect that I think that there's a lot of conversation to be had. So if I am speeding up and anybody would like for me to slow down, feel free to come off mute and ask me to take a breath. I'm happy to do that. But if we can go to the next slide. So like Katrina said, we've created some slides to kind of show where we're moving forward. And I think on pieces of these, we may be able to sort of start to illuminate that thread of the interconnective pieces of the different roles, but also the different purposes. And so this timeline here is really looking at the piece of the legislation that specifically calls out building capacity in TNTA providers. And so we are looking at TNTA providers as both those who are within the CCRNR world, but also in some of those additional roles we talked about, and in additional organizations that may be providing TNTA out in community. And so we're going to be really focusing, as we can see through the lens of an implementation science. And so right now, and where we've been is really identifying needs and examining innovations. So you can see a list there, and I'm not going to read through all of them, but then moving on how are we getting resources in place and preparing organizations, whether it is through their own capacity building, through building relationships, through articulating how we foresee interactions happening between systems. We want to really make sure that we're integrating the regional service providers and the central entity in the development and the implementation supports. And so that will start to solidify and illuminate where that thread is in between the roles, as well as an expansion of coaching skills and competencies through our current T and TA roles. And then if we go to the next slide, we can see where we'll be also engaging in some feedback loops and continuous quality improvement. So establishing some routines and levers in the system, and then looking to see where we may need to manage change and create continuous cycles to identify where improvements can be made. If we go to the next slide, we wanted to share a little bit with you where we are on our foundational pyramid model training, knowing that that is work that has been happening in Oregon for quite some time and has been an interest of the council. So we have funded what are called training the trainer sessions, and those have been funded through DELC and provided statewide so that folks can come on board and become trained to be official trainers of the pyramid model, which means they can then go into their community and begin working more closely with programs around the pyramid model. These have been offered in both English and Spanish, and we have some additional sessions starting up, I believe, next week and going through May that are in Spanish and will focus on both preschool and the infant toddler modules. And then we've also been doing this work in collaboration with OECI and through the Oregon Department of Education. And these have been provided at no cost for participants. And I also wanted to point out that through our partnership with OECI, which is the Oregon Early Childhood Inclusion, and ELSI over at OSU, there will be e-modules of the pyramid model that will be launching in the fall. And so those will also be free to anyone in the state who would like to take those modules to become more familiar with pyramid model, and then work closely with a TA provider around implementing the pyramid model within their program. So that's another way that we are moving forward to expand capacity around that. Next slide, please. So the focus of this timeline is the development of additional skills, knowledge, and competencies for early educators and providers. So this is more in the classroom and program level. It's aligned with the capacity building for the TA providers that we looked at earlier, and really thinking about how it's contributing to the ecosystem of supports. We want to make sure that we're not burdening the increased knowledge completely on the educator or providers. We know that suspension and expulsion is a result of root causes that are systematic and not a deficit-based model that looks at where the professional in the classroom needs to improve, but really trying to indicate where can we create some support so that each educator and provider can be successful. And so meeting educators where they are and walking with them to support programs so that they are welcoming, accessible, and inclusive. So you'll see some of the highlights that can include increasing trainer opportunities and access to trainings for programs, and looking at that both in a linguistically diverse access as well as culturally responsive professional learning. And then thinking about expanding beyond that one-time training to those implementation supports again. How is the information being provided meeting the needs of the program? How are they installing those skills, knowledge, and competencies into practice? And how are programs engaging in continuous quality improvement? We can take a brief look at the next slide, and that again will demonstrate those last phases of the program up until launch, of really getting into some regular quality improvement cycles. And I'm going to pass it back over to Katrina now.
Thanks, Andy. Let's go to the next slide.
So let me just ask a question. So can we assume that, Andy, you are the lead person for training and TA? Is that correct?
I think that that is a safe assumption at this point, but I do want to recognize that training and technical support is going to be really multifaceted and is incredibly important. And so it will rely also on relationships with partners in community and really building that community wealth. So there'll be additional voices, but also for DELC right now, this is a project that I am prioritizing and mainly focusing upon.
Okay, thanks. As I look at these 4 quadrants, it's helpful to kind of know who's where.
Absolutely.
Okay.
Thank you, Chair.
Okay, thanks.
I think about some of this work, some of the work that Andy's leading, some of the pieces that I'm leading, as being about coordination and collaboration, or coordinating the collaboration with both our colleagues and our adult colleagues and our external partners, because it's certainly not something that any one of us can do. So a little bit about the infant and early childhood mental health consultation. Let's go ahead and go to the next slide. So these are just some of the priorities that we have. We're very conscious and committed to diversifying the workforce, creating pathways into the field of mental health consultation, looking at possibilities for grow your own options for building our workforce. We want our consultation to be explicitly focused. It needs to be explicitly focused on addressing and preventing suspension and expulsion. And we want it to be that support, like John and Andy have talked about, supporting the educator, something that avoids placing blame on the educator or the child or the family, but providing support all the way around to help resolve the concerns and maintain the child's enrollment if possible. And there are a lot of knowledge and skills for us to think about how we develop in our workforce. So next is the thinking about our central entity. And let's go to the next slide. So each one of these 5 numbers represents, like, we could have a slide on each one of these, or a couple slides on each one of these points. So know that these are the headlines. There's a lot of details in it. So there's sort of an alternate name that we're using for the central entity, which is the Oregon Center of Excellence on Infant and Early Childhood Mental Health Consultation. And this is to recognize that we don't have at this point, or well, now we do, but we have not had an organization, a statewide organization in Oregon that really is our go-to source for learning about the practice on mental health consultation, about equity-centered practice in mental health consultation, and building our workforce. And so we're really asking ORMHA to take that on and help us to work closely with us, to work closely with regional service providers, to engage with CCR&Rs and hubs and other partners in our early learning system to really build a statewide model. And so what we're really looking to do is build a statewide model that hangs together and has commonalities across regions, but also has flexibility for regional variation. There's differences between the urban and the rural contexts, for example. And so we want our model to be able to take that into account, as well as cultural and linguistic considerations. So there's also the aspect of mental health consultation is a little different from coaching and a little different from other forms of consultation. So we're asking ORMHA to help provide the sort of technical assistance to the organizations, to the regional service provider organizations around how do we need to think about, what do we need to plan for, organizationally, systemically within that organization to implement mental health consultation. Continuous quality improvement, evaluation activities. And this number 4, it's one simple little line on here, but it's a big piece of work. And I know that Arumha is very excited to get going and engage with multiple system partners in gathering perspectives, collaborating together, and helping create this coordinated system of support. And much of that is also in number 5, like really looking at equity leaders in Oregon, early childhood system leaders, and making sure that we're all working together, collaborating together. So let's go to the next one, which is about our regional service providers. So these 5 points are the areas that we asked region applicants to respond to. And these 5 kind of sections were identified through an advisory process that was led by Trauma Informed Oregon that engaged a group of people from across the state of what are the things that we need to consider, what's important. And one of the things that we heard loud and clear was we want our regional service providers to be actually located within our region. So we said, are you in the region? And we wanted to know, how are they already connected to early learning and care programs in their region? We wanted to know how they're already connected to CCR&Rs, to hubs, to tribal programs, to other early childhood systems in their region. We wanted to know, well, do they take care of their people? Of course, that's a little hard to get the full picture in a application, but we asked questions around their equity-centered and trauma-informed organizational policies and practices, including the ability to provide compensation for that meets a minimum salary level, and then also has the option for incentivized compensation for bilingual abilities or for lived experience. And we also asked about their experience with mental health consultation or other community-based services, and their sort of commitment to their thinking about the value of mental health consultation as a strategy to prevent suspension and expulsion. And let's go to the next slide. Oh, one more thing I should mention with that one is we also asked them, will they commit to developing and implementing a workforce equity plan, a mental health consultation workforce equity plan, which is the recognition of this is a complex skill set. There are traditionally, the route into mental health consultation is through higher education. And so how do we kind of pull that apart, look at what are the essential skills and competencies? Let's think together and actually embed this in the planning process before they go out and hire someone. Okay, so now let's go on to the next slide. So the role, right now they are in a planning stage. All of them are in a planning stage where they are working on building relationships. In a little bit, we'll talk more about the coordinated system of support. It's about planning for that, taking the time to really ensure some of those systems, some of those collaborations will be in place. Also taking time to understand how is mental health consultation different from coaching or the work that quality improvement specialists do. And then phase 2 will be actually transitioning to that recruitment, hiring of mental health consultants, responding to warm line requests for support, and delivering mental health consultation services. The next 2 slides are our list of regional service providers. And these are, 8 out of 11 regions. The hub or the CCR&R, in some cases, and are involved, are either directly or indirectly involved in the partnership of the regional service providers. The regions for the regional service providers are the same as the CCR&R regions. So we set that up intentionally to have that alignment for coordination purposes. And the now I lost my train of thought. Sorry about that. To answer your question, Ruby, about the distribution of the roles, we identified a floor of 1 FTE in each region. So it's really hard to hire if you only have a fraction of a position. And so we established that floor. And then beyond that, we made some adjustments for population, number of early learning programs, and also the geographic space of the region. And so I think it is the most populated 4 regions that have a little bit more than 1 FTE. I would need to go back and look at the chart to tell you, to confirm that it is the top 4.
So I think this is only going to work for the council if we can integrate questions as we go along, the way we did with the strategic plan piece. So regional service providers are a pretty key part of what this new system is going to be. So council, let me just ask Katrina to stop for a minute and see if there are questions on this or the central entity or RIMHA or sort of what we're hearing in this whole section about the infant early childhood mental health consultant services. Yes, thought so. Ruby.
Thank you. Just for transparency's sake, I'm curious how, I mean, I love the work of RIMHA, but I'm curious how they became sort of the contracted provider for the overall project and what that selection process looked like.
Mm-hmm. Yeah, great question. We developed a request for proposals, and we opened that, I think it was the end of December, was open for 6 or 8 weeks, and we received several proposals from organizations around the state. And in our selection process, they were the organization that had the greatest connection already with system partners around the state, and according to our scoring outlines the priorities that we were looking for, they had a lot of those pieces in place. Yeah. So John, would you add anything?
I would say that they also articulated really specifically how they would launch rapidly into the work with partners, and very specifically outlined how they would do that, which was a key factor in their selection.
Yeah.
Robin.
Thank you. I'm going to pace myself with my questions because Sumit might have something else. And so I'll just say a couple of them. One, I'm so excited that we have the impetus to establish early childhood mental health consultation across our state. So those of you who know this is like a deeply passionate area for me. And I love that it is by nature cross-sector, and all of your visuals that describe that cross-sector nature are so helpful for making sure that we put that at the center, that families are in these complicated systems, and we need to make it not complicated for them or for providers. When I'm listening to the way that you're laying out the different roles. It's super complex. I can only imagine the amount of visuals and clarity that the field is going to need as this rolls out. And when I think of RIMHA becoming the center entity, it's really helpful to have a neutral central entity, not unlike the home visiting work that we're doing in other areas of the state. Having a neutral entity that works across different agencies can really help with communication, just with being able to work across sectors. And so I wonder, right now, you probably have it in additional slides and it's probably a part of the plan, but a lot of my questions are around who's overseeing what, where's the communication pathways, and what's the roles and functions, and how will everybody be kept in the loop, and some of the transparency in this opportunity. For example, the advisory, is that something that a central neutral entity would staff or oversee so that it's not seen as just DELC, but making sure everyone owns it? I think that I could go in a lot of different areas. I think that I wanted to share the geography, just one of the 22 spread across in the more densely populated areas do need more. And we have to remember areas like, for example, Douglas Klamath Lake, that is so geographically large that the amount of time people spend driving to get to another area eats up all of the actual time. And so I know we grapple with that as well. I can only imagine how complicated that is. And then one more thing before I just stop talking, and I'll put a pin in all the other ones, is the timeline. So I imagine it like horses running a race. I don't know why this is my visual, but stick with me here. Is we've got this sort of 2026, these sort of lines in the sand, you might say, and you're developing all of these supports for the field. This horse is running, and then we have this deadline. I just wonder if there is any ensuring that adequate support for the field, which is going to take time to establish. I think that the answer you would say, so help me with this, is in that when that deadline in the sand happens with the suspension and expulsion ban, that we will have a transition period where we're really taking into consideration all of the supports that are needed that haven't been available to the provider. I worry that we're going to be losing newly recruited programs because the support isn't there, and they're fearing what will happen. And so it's just a sensitive time, and I know you have this on your mind as well. I'll stop talking for now. Thank you.
Yeah. Alyssa just noted in the chat that Alicia Gardner is here, and she'll speak a little bit about the enforcement piece later. But yeah, there is, I like that image of the horses running, like we're running a race towards July of 2026, but it doesn't stop there. That it just, we keep going, and we're going to learn so much when that ban starts around what else do we need. And so it's a race to July 2026, but that's not where the race stops. We'll keep going. It'll just be a different phase of the race.
Subin.
Okay, I'm going to say a lot of things, and you're not going to really be able to respond to all of it, so I apologize. But
that's good.
I need to slow my heart rate down, because in my head, I'm hearing all of these voices of people who really care about this program. And we know about the grassroots effort that led to this legislation, and so many people who are pinning a lot of their hopes and dreams into what this program can be and what it can do for the field. And I'm also hearing the voices of people who are really concerned about the enforcement aspects of it and what's going to happen to their businesses and their programs and things like that. So I'm hearing all of that and feeling that in my body right now. My main overarching concern is related to what Robin was saying with the horse analogy, is time. Will this get together in time? with all of the different components and the complexities and the challenges that you've been presenting today. In regards to a question that was presented to us about how can the council help in connecting all these disparate pieces, I think we can only do that if you present us a vision of what the connections need to be. And then I think we can be of best service. But we need to know where, like, what are the connecting points, right? And how are these different agencies, regional entities, how are they being connected together? And so I have a bunch of questions here that I would say, like, what is actually being managed by DELC, right? What is being managed by the regional entities? What is being managed by the central entity? What is being done by other agencies? And I'm not clear on what those things are. And so that's one thing. Another thing is, I appreciated hearing about the quadrants, right? In terms of the buckets of work, the what is going to happen. But I have a very different question that's related to that, but it's an important distinction. And I'm thinking about drivers. What are the drivers that prevent suspension and expulsion? We heard about inclusion, but that's an aspiration, right? When I think about, like, what are the actual drivers and indicators, I'm going to just go off the top of my head because I'm not hearing them, are like, we need a strong classroom foundation with developmentally appropriate practice and an understanding of guiding behavior and, you know, what is expected of young children, right? And that needs to be in place. We need to counter implicit bias, right? What are the actual strategies that counter implicit bias? We're hearing about infant early childhood mental health consultation. For me, that's a driver towards supporting behavioral health and wellness. And then there's another driver in terms of inclusion with children with disabilities. And we're going to hear about OECI and some of the other stuff, right? So in each of those drivers, there's different what's, right? There's different quadrants, actions that are happening in each of those places. And so that's the vision setting that I'm talking about. Like, if it were my opinion, I think that's the role of DELC, right? Is to set that vision and say, you go here, you go, and be the quarterback and say, you go there, you go there. Or maybe it's not you, maybe it's ORIMHA, or maybe it's, but someone needs to be doing that. I really believe that. And that leads me to my next question of what is the role of the central entity? Is it just on infant early childhood mental health consultation, which is a big task, huge task, but can there be more there for the central entity? And then another question around what are other initiatives or things that are in development that are going to line up and support the drivers that I was talking about, right? So we have ELSI and coaching, and Andy, you named so many things that have been in development before this program ever came into place, right? So what are the existing things that can help? Last thing, regional entities. I feel like they're going to need a lot of support, a lot of communication. And there was a slide that showed the years, like we were hearing what has happened in the last few years. And I didn't see anything in terms of communicating and coordinating with regional entities on what their role is going to be in doing this work. That's what I have for now.
Thank you, Subin. Yeah, okay, I'll respond to the last part first, which is just in terms of supporting the regional service providers. The last organization to have their grant executed was just a few weeks ago, at the end of March. So it hasn't been very long that those regional service providers have actually had their grants. And so they're really just getting off the ground. Unfortunately, there was a crossover with my own personal medical leave. But we're on the other side of that. We have ORIMHA coming on board. They are very eager to jump in. And so next week, we have a planning meeting with ORIMHA. And then we have another kickoff meeting with our regional service providers. But ORIMHA's role is really to jump in there and help provide that coordination and support for regional service providers in kind of all aspects of what that means, in the program development as well as the support, the actual implementation support. And
And is all of that in the contract that Delk has with the RIMHA? Because I know the regional service providers were selected before the central entity was, which seems a little backwards, but maybe it can work that way. So did a RIMHA know how much they were taking on here?
Yeah, we wrote it into the request for proposals. It's written into their contract. So they are aware, and I think are very eager to get going. And they're very excited about it too. It's not just that they're ready, but they're excited. They've been, checking in every couple of days. Where are we done? Are we ready yet? So it's a big body of work, and no, a RIMHA's role won't be solely limited to mental health consultation, although there's a big lift to be doing there. And we don't have any other, organization that is helping support that lift around mental health consultation. So there's a big piece of work there, but there's also thinking about what other shared professional development can we implement for training in TA professionals and other kind of roles across our system. So there's a lot to be developed there. Yeah.
Pause for a quick second. I know that there's a question that Sue might want to call on and some questions in the chat box, but I want to just mention that the amount of stuff that was dropped in the last 10 minutes, we're trying to capture that too, to think about ways that we can follow up with additional information beyond just this meeting. We know we can't get to all of it right now. But I also wanted to just highlight for our team, we might want to highlight slides 30 and 31 around this and the coordinated system. But I also wanted to check in, Sue, our timing here is limited. So I want to think about what you want us to do, because we can go various ways.
So can I name maybe a frame of what we're trying to accomplish with this presentation, if that would help dictate next steps?
Sure, thanks.
We've heard from community partners this feeling or assumption that there's not a lot of work happening in this area. Part of this is to demonstrate the breadth and depth and complexity of this work, to show we promise we're actively working on it. It is incredibly complex. Robin, to your point made earlier, so much of this is to describe this complex system we're building. The goal is for this to not feel as overwhelming and complex to the provider or families, right? So we have to make sure that the back end is coordinated, the 4 quadrants and the pyramids and who all is talking to each other. Folks shouldn't feel that, right? We just need to make sure that the infrastructure is there. When we think about going back to that pyramid model visual, there is a lot of emphasis happening on the top of the pyramid for those intensive interventions. That is where we have had the least amount of investment in this system, and whereas there's the greatest gap in services for community. It has taken a lot of work to be able to pull all these pieces together while simultaneously creating the top of that pyramid, which we're doing via IMHC. So Subin, to your point, there's a lot of concern about getting these resources stood up. What we need to be doing is working with the advisory group and the advocates that really drove the ban and the establishment of the program to find the balance between enforcement and community readiness, and not wanting to create loopholes that completely disempower the ban, and recognize that there are key supports that aren't sufficiently available in community. Even when this plan is done and the timelines are implemented as the team has been articulating, there's not enough resource in community to be at scale, which is why we also hope to be requesting investments through our POPs to continue scaling the program. So we are racing towards this finish line that is in law regarding a ban. And it's important that we're working together about threading the needle between enforcement and regional capacity and availability. And we're not going to do that alone. We need to be doing that with community to find that balance and recognize that there's going to be tension, because we want a ban that's real, because children are being disproportionately harmed by these practices. And if they need services that they can't get, we also have to acknowledge that in our system limitations. So that was the purpose of giving you all a ton of information, is being able to better articulate the complexity and intentionality around this system design. I think to your question, John, maybe jumping to slides 30 and 31 to take a zoom out of what this full system is. And you all can continue to review the timelines of these other pieces. You can look at the regional service provider list and send us your questions, because I think we're also getting stuck in the big picture. And this is a key part of that larger picture.
Thank you, Alyssa. So let's actually go to 31, and then we might come back to 30. This is a diagram of, and we may be missing some, so it may be incomplete, but this is a diagram of some of the partners that may be involved in supporting an individual child or the early learning program that child is enrolled in. So when we, so we have the ones that are in sort of the green are ones that are funded by DELC. And so DELC has kind of a direct influence over the scope of work around these positions. The ones that are in yellow are an alternate, either federal or local funding. The ones in blue are funded through the Oregon Department of Education. And then this kind of brownish orange one is behavioral health. So behavioral health is the least likely of all of these to have a direct supporting role for the early learning program, but they may be supporting an individual child or that child's family. But now let's go back to the previous slide. So when we get a request for support, a lot of times that is going to come in with a specific child in mind. The educator is going to say, I don't know how I can support this child anymore. This child can't stay in my program. And however, when we take a deeper look, it may not actually be, the child may be like showing the symptoms of a different problem. So it could be about the staffing patterns. It could be about something about the environment is not supportive for that child and other children. There could be undiagnosed delays or disabilities. That could be about educators' skill in social emotional teaching practices. It could be about the mental health of the educator or the child. There could be trauma in the child, the parent, the educator, the community. So there is a need to kind of take a look when this request comes in of what is it that actually needs to be addressed. And then that leads to a question of who is the best person to respond to that. So now let's go back to slide 31, which is that depiction of kind of all of those different roles and entities. So in some cases, it may be the infant toddler specialist who's already connected with a program, the infant toddler specialist who's at the CCR&R, or it could be that it's in Multnomah County, Preschool for All has a team of mental health consultants. Maybe it's one of them, or maybe it's somebody who's a behavioral specialist at a school district pre-K program. But it's kind of taking that zoom out to think like we don't have the capacity for those regional service providers, the mental health consultants, to respond to all requests for support. So thinking about how do we look at our whole system and the capacity of multiple roles to support children, support programs, and prevent suspension and expulsion. I'm going to just pause there for a second. Any questions about that?
Okay, what's happening, and probably predictably, is that we're running out of time. We've asked Alicia to be here, as you know, she's head of our childcare licensing division, to talk just briefly about enforcement, what we know or don't know about that. There are lots of really great comments and suggestions and questions in the chat that do need to be considered and addressed, but we can't do it today. So I'm just going to suggest, Alyssa, if this sounds okay to you, that since Subin's on the advisory committee and not on his screen right now, I'll just assume it's okay with him, that Subin and I can meet with you, Alyssa, and John, and potentially RIMHA, because they're such a critical piece of this puzzle, and try to understand what is the potential role for the council moving forward in this very, very important work. And understanding, as you and your staff have pointed out, it's bigger than just this program. This really is huge system change work. You know, it's tantamount to what I think the council has really initiated with the home visiting system coordination. And potentially this needs to rise to that same level of focus for the council, or at least I think that's something that the council will want to consider. And I see that Marie's just asked a question about the rural representation on the advisory committee. And I believe there is at least one, if not more, people from rural Oregon. But
Yes.
Good question, Marie, and we will be able to address that. So Subin, I volunteered you to join me in meeting with Alyssa and John and RIMHA and try to figure out what are the next steps, especially from a council perspective, in advancing and supporting this work.
Yeah, happy to do that, Sue. I think maybe an interim step will be let's meet without RIMHA first, because I think there is a difference between the work RIMHA is doing as the coordinator and some of the gaps we really have that the council can help us fill in terms of system connection and the agency to agency conversations that are challenging, particularly as we think about the other sector's readiness for the outcomes of these services. And that's not RIMHA that's not their role, right? So I think it'd be helpful for maybe us to have that internal conversation, get a little bit crisper before bringing in RIMHA, and not conflating the home visiting system coordination work and the council's role there with RIMHA and the work happening there.
Okay, that sounds good, Alyssa. And if there's another council member or two who are willing to spend some time and really focus on this with Subin and myself, Alyssa and John, we would welcome some. Thank you, Robin. We would love to have your input. And if anyone else is willing to allocate time for this, it would be great. This is obviously very, very important for the system building that we're all talking about. All right. So thank you, Peter, very much. So Peter will also join us in this, which will be great. Okay, we'll try to pull that meeting together sooner rather than later. So remind me now, can we, John, I know we've totally interrupted your presentation, so I'll apologize for that in advance. We are scheduled to talk with or hear from Alicia now, but is there anything else that you, and I know, well, I don't know who's left on the call. Anyway, anything else you want to add to this?
Thanks, Chair Miller. I just would say it's really hard to know sort of and understand all of the components that we're speaking to with a couple slides and an hour, you know, and I would love to say that we could convey it all better in an hour, but I just appreciate, you know, because I know that as you're listening, it can be really hard to keep moving with us if you've got real big questions that are preventing you from doing that. So the pause to actually hear the questions was absolutely critical, and I know it leaves more questions for you all. And I think that we, again, want to just mention that we're capturing what has been said so far. We want to be able to articulate and have some answers to some of those things, which will create more questions that we can continue to think about too. And I just wanted to mention that Dr. Andres Lopez, we messaged a little bit back and forth, but just he wanted to make sure that you all knew that this was such an important conversation, that he's more than willing to come back at a future point to talk about the study and the evaluation components, and that this was a critical conversation, and he just wanted to give you the space to have it. So
thank you. And please apologize to Dr. Lopez that we didn't get to him today, but we will make time in another agenda so that we can hear from him, another critical player in this. All right, Council, let's move to Alicia and hear briefly about enforcement, what she knows or doesn't know about it, and then we'll see where we are. Okay.
Thank you, Chair Miller. Hi, members of the council. I'm Alicia Gardner. I'm the Child Care Licensing Division Director. It's nice to see you all again. Before we jump in, I have just a couple of slides that I'll touch on briefly, but I wanted to start by just saying that it definitely resonates with me when I hear council members talking about the availability of resources and how that intersects with the enforcement of the ban. And I know Alyssa touched on that briefly as well for you all, but wanted to frame this up that we are thinking about this as we are looking towards the ban, and also noting that the ban is still a couple years away and has a legislative session in between that. And I think you saw a preview of our legislative concept from Kate Dennison earlier. And so there's a lot to be built within this. I think that's what I hope council understands and knows, that we're still working on a lot of this and we don't have all the answers right now. And we do understand that whatever it is we build in relation to enforcement has to do a couple of things. One, we want to fold it into the systems that we already have, but two, ensuring that there is availability of resources prior to enforcement, heavy enforcement of such a requirement within a childcare licensing set of rules. So if we can move to the next slide. The first thing that I have for you to know is just kind of a frame up of how CCLD enforces its rules in its current state. So very similar to many early learning structures that are out there, we have a pyramid model, and our pyramid model relates to kind of the theory of regulation of humans, human regulation, and is used in a lot of other places where human regulation exists. So things like group homes, adult foster care, childcare, this is a standard model of how these kinds of rules are enforced on a national scale. So at the bottom, you can see that there are preventative and corrective strategies, and the majority of programs fall within this bottom level of the pyramid, where they are subject to regular ongoing monitoring, lots of technical assistance so they can learn to be in compliance with the rules, understanding their resources from us, and then also we consider like a non-compliance letter or a singular violation falling within this preventative and corrective strategy approach, because they're not actually what we call legal actions or things that are subject to hearing rights. We then move up the pyramid as problems scale up, or as the seriousness or as threats to health and safety of children increase, to intermediate sanctions. And then we have terminal sanctions, which would be a revocation or denial. So the intent of the intermediate is to get programs back to that preventative bottom base of the pyramid. I'm showing this all to you because in last year, the legislature did require DELC to provide a report, which would the meaning of the report was to propose how do we want to enforce the ban. And our proposal in that report is to fold it into the structures that we already have. And the legislative concept would give us, if, should it be turned into a bill and move forward, will give the council authority to do rulemaking for the ban and fold that into the childcare licensing rule sets. We also have in our rules this definition of serious violation, which you can see on the right-hand side there. As it stands today, a violation of suspension and expulsion, should this be in our rule set, would not fall into the category of serious violation. Currently, any serious violations are typically immediately moved to a citation within our system. But if we do not treat a violation of suspension and expulsion as a singular violation as serious, then we can address this through technical assistance. And what technical assistance would look like in this case, as far as we have determined so far, would be referral in DELC, as you just heard. We also know that if the services are unavailable, this would still be something we can address with technical assistance and, flagging it within the system that, this would not be something that we would enforce because there wasn't a place to provide it. If we can move to the next slide. So that prior slide explains how DELC proposes to enforce the requirements of House Bill 2166 as well as Senate Bill 236, which is the ban. And that would be to use the existing complaint investigation, remediation, and action processes currently used by DELC to enforce the other childcare licensing rules that we have. However, neither House Bill 2166 or Senate Bill 236 granted DELC enforcement authority for new requirements established in those bills. So without the statutory amendments, the requirements will remain symbolic and unenforced. With statutory changes, enforcement of the ban and investigation of the violations would be available to DELC for the facilities currently subject to the monitoring and investigation, as well as DELC's progressive enforcement approach, which you just saw, that begins with regular inspections, provides educational resources, technical assistance, and referrals to support services prior to any intermediate or terminal sanctions. So to implement the goals of Senate Bill 236, DELC recommended in that legislative report that the changes, legislative changes, which would grant the Early Learning Council authority to approve administrative rules related to the investigation and enforcement of matters involving suspension and expulsion. And that will also allow the Early Learning Council and DELC to create clear rules and processes of how investigation and enforcement of violations of the ban will be carried out. So granting the rulemaking authority to the council will also address another challenge in implementing the enforcement of the ban, which is that there is no flexibility within Senate Bill 236 as it is currently written. It doesn't give the ELC rulemaking authority, nor does it give DELC the discretion in enforcement of the ban. So that will limit DELC's ability to use contextual and flexible approaches while enforcing the ban, such as the availability of resources to that provider. It also does not provide any flexibility for exceptions. So, for example, if a child is a perpetrator of abuse towards other children, the facility would violate that ban by expelling that child in an effort to protect the other children in care. And in particular, there may be safety plans in place for children that come from partnering agencies like ODHS, where a child should not be around childcare children. And so we want to be able to have those flexibilities when we are partnering with partnering agencies in the interest of child safety, to ensure that there is flexibility within these laws and rules. So DELC is recommending that the statute should be amended to provide for rulemaking authority for appropriate exceptions and other requirements, including those described in the support portion of the law. So that's what we have currently, and I'm available for any questions if the council has any.
Okay, thank you, Alicia. So obviously, lots more to be done in this arena and in the upcoming legislative session. So it may well go on the list of what council wants to weigh in on during the session, Alyssa.
Absolutely.
Questions of Alicia? So the rulemaking is going to land right back here, council members, which is where all the rulemaking happens. So it's obviously a program and an initiative that we're going to have to really stay involved in and, yes, knowledgeable about. Robin.
Thank you. I think I want to learn alongside you as we move closer. So I probably have too many questions that don't need to be today. When you described the partnering with other agencies like ODHS, for example, that adds the extra complexity to where I just want to get clarity about what that would look like, the council's role. I keep coming back to, and Sue, maybe this is a question for you and the council's role, is with Raise Up Oregon naming other agencies beyond DELC, when there are these really specific overlapping work that we're doing together across agencies, DELC is writing into their strategic plan the action plan for the Raise Up Oregon. Does the governor expect the same of other agencies who have named early childhood Raise Up Oregon specific strategies? And if so, do we get to see that? There's just, I kind of want continuity across the early childhood Raise Up Oregon agency strategies. And in this particular one, because it's so critical that we get this right, and if we as a council are going to have that kind of responsibility, I just want to know like all of the ducks to put in a row. Versus ducks. I got an animal thing today.
Well, and Alyssa, I don't know if you can respond to that very, very legitimate question.
Yeah, in terms of the governor's agency expectations, there's no named expectation that the agencies involved with the Council of Raise Up Oregon include that work in their strategic plan. That being said, given how Raise Up Oregon 2.0 was developed and that it was very heavily driven by the agencies, we do anticipate seeing a lot of that work come up through that. There's not been work, to my knowledge, and Gabby and David can correct me if I'm wrong, as they've been developing that, the crosswalk that like we did for our strategic plan with DELC, I don't believe the other agencies have done that. That doesn't mean when it's finished that we can't provide that same analysis and pull out where those through lines are.
Yeah, great. Oh, Ray will be delighted to hear from us. I'm sure. Subin and then Peter.
This might just be stating the obvious, but whatever needs to be communicated out to programs about the enforcement probably needs to happen sooner rather than later. And so just coming up with a holistic communications plan rather than relying on one strategy to get the information out there is going to be really important. And I imagine, I would say there's probably going to be a big communications plan needed, not just in regards to enforcement.
Thanks for that, Subin. Absolutely agree. We have communicated out at in a couple places. I believe we presented this out at our provider information session, and we also have been coordinating with AFSCME on this, and they're aware of that. And then through the legislative report, you know, that's also been open. But you're right, we do need to communicate this out. There's still a lot to be determined, and so, you know, with this preliminary information, it's pretty much where we're at for now until session, until legislative session. And so while we're working internally on ideas on how this could potentially look, we just want to make sure that we're aligned and coordinated with what occurs in legislative session on this bill.
Thanks. Good comment, Subin. Peter.
Yeah, I was just going to say a similar thing to Subin. Communication is so important here. I think it's important that providers know that we're not going to hang them out to dry, that basically that we're trying to find that balance point, but we're going to try to provide the resources, and we're not going to just leave it on them and leave them without resources to address the needs of the kids and the families they're working with. Just can't emphasize how important that is.
Right. I'm sure everyone's hearing concerns that are being raised already. Marie.
Just briefly, I wanted to just ask, do we have a really great or robust way to track when it comes to programs and giving their reasons for shutting down or stop providing care, that there's an opportunity for them to provide explanation as to why? And if this is part of their explanation, that we are able to capture that and track it, so we understand the impacts that we're creating through this legislation and program, so things can, if we need to reassess in the future, we have data.
And I don't know, John, I think that's a component of ARIMHA's work as a central entity, is that we, and John, correct me if I'm wrong, that some of that data collection of when this is occurring, when the calls are being made, when these instances are occurring, that we are able to capture that. John, is that right? Would that be part of ARIMHA's role?
ARIMHA would be analyzing the data where the sort of warm line data system exists, could be at a different place than just ARIMHA, but really we need this closed loop of what's occurring out in the field when the services are being provided. Ultimately, do we know, and can we track, has the child been asked to leave care? Were we able to maintain care for children? So all that will be captured. If a program closes down and it's in the course of the services, we'd be able to capture that. But we may need to make links with our own internal DELC systems around childcare providers entering or exiting service. So that's a good implication to think about.
Yeah, and I think what I was hearing, Maria, is sort of like the need for like an exit interview, and that is actually something that when we were during the when we had evaluation dollars to our PDG grant, we did something very similar with providers who closed down permanently during COVID. Our researchers actually did a really wonderful set of focus interviews with a group of those providers. So I think that's something to keep on our radar, to see if we're able to do some version of that again in the future. I know that was really illuminating what the provider shared with us. Actually, that report from COVID is up on our website as well. But I think that idea of some version of like an exit interview for folks leaving the field, is a really important idea to capture.
And maybe I could add to that too, that if providers have an opportunity to provide information about, are they losing other children in their operation because of, children's, the behaviors, the time it's taking to address one child versus the multiple children that there's just other spin-off things that come from this that I've heard people are really concerned about. And then that gets into a whole host of other questions around the financial viability of operations, being able to afford to keep kids with high needs without additional financial supports from DELC.
Yeah, great points, Marie. Thank you. And John, is there a quick answer to who's going to decide where the warm line lives?
Quick. Let me think about that. So we're in the middle of assessing a few different. There's both the portion of the warm line, which is how does somebody submit a request for support, and will that be online, and will there be phone line opportunities for people to talk to someone? And so that's the sort of the front end, and then there's the system that sort of tracks all the services that will occur after a request is made. And so we've got a need for the warm line to be both of those things. And so that requires some data system infrastructure work through our IT team and the through Department of Administrative Services in order to land on how can we do that piece of the data system. And so we're waiting on selecting which one of those data tracking systems, and then we'll finalize the who will be the keeper of it, because it sort of depends on which system we use. And that's not helpful to you, but we will have updates shortly around the next steps on that. It is moving forward, but all the things have to happen kind of simultaneously in order for us to land where it'll be and what system we'll use.
Wow. And so we end up right back at the beginning of this conversation saying it'd be really nice to have this map of all these different pieces and how do they fit together, so I think that's what we're missing right now. And maybe it's because we aren't involved in this on a day-to-day, minute-to-minute basis, but I think we're going to need that big picture of how does this hang together. Okay, John and your staff, thank you very much. Alicia, thank you for your overview. Council members, thanks for very thoughtful questions and comments. Lots of information in the chat that is going to be very informative for all of us. And I want to thank Subin, Peter, and Robin for agreeing to be sort of an informal subcommittee right now to work with Alicia and John. So we now have a 25-minute lunch break, and we will be back at 12:30. Thanks, everybody.
Just a reminder that the live stream does stay on, so just make sure that you're on mute and that your camera's off.
Thank you.
Hey, Whitney and Danae, thanks for joining. Council will be back at 12:30, so feel free to just hang out. Camera's off. You don't have to have it on right now.
All right. So we are back on. Welcome back, council members, and welcome to some of our guests who are on. We're going to just take a few minutes at the beginning before we start the Business Oregon presentation. I asked Carrie McCann if she would, we moved her over from the morning to now. So Carrie's going to give us a quick update on the Hub work group, and then we will go to Business Oregon. Carrie, thank you for flexing your time.
Great. My pleasure to be with everyone, and really enjoyed the morning conversation. Thought it was really important. So was glad to shift my time. I think we just wanted to make sure that it was on all council members' radar that we are in the middle of a process with the hubs, DELC leadership, and several of your council members as representatives from this group around the work with the hubs on, given all that we've learned, all that has been written about the hub work, how it shifted over time, really solidify agreement and understanding of what are the core roles and functions of hubs in both advancing the Oregon's regional early childhood system and how important they are to Raise Up Oregon, and to their important particular role with DELC around the early learning and care sector. There's been a lot of great work that has been done, and I think this is a time to kind of solidify what is it that all hubs should share, and then what is the infrastructure and operations that would support that being the strongest system possible for really the ambitious work that they have and that the council has of really thinking about the importance of an early childhood system in the state, both having the state level work that's represented in Raise Up Oregon, but then the connection to closer to on the ground work that is done through regions and local communities. So what you see in the handout that we distributed earlier this week is really just where are we in the process. So we're in part one, which is really confirming the vision and what is it that we're trying to strive toward to all hubs having shared in common. So you can see that we're working our way up to an in-person meeting in May, where we're hoping that will all be solidified so that we can come to you for the in-person June meeting and really talk about the progress that has been made there, and then shift quickly to the conversation around infrastructure and operations. I think this will help the work between DELC and the hubs move forward. We think this will help with our engagement with other state agencies around the benefit that all the sectors benefit when you have a strong regional early childhood system, and the role of an organization like a hub in regions to work with our state agency partners, in addition to DELC's investment in the system. So Sue, I don't know if you have other reflections that you want to share, but I think we just want to earmark that we'll have dedicated time for this discussion in June. And then we expect this to be an important discussion at the October retreat.
Yeah, thank you, Carrie. That's really, I think that's sort of the placeholder that I was looking for. So thank you for the very quick update and overview. And also thank you to Liz and Peter for being on that hub work group with me, hub directors, Alyssa and her staff. So thanks, Carrie. So next, let's move on to Business Oregon. Thank you, guests, for being willing to let me get Carrie in before we get started with this update. And Gabby, do you want to kick this off for us?
Yeah, sure. So we have some staff here from Business Oregon and DELC. Lindsay, Danae, and Whitney, thank you so much for being here. They are some of the staffers who are taking the lead on the childcare infrastructure work. Would each of you mind just kind of introducing yourself really briefly for the council?
Sure. Hi, everyone. I'm Lindsay Cochran with Business Oregon. I'm the Childcare Infrastructure Fund Coordinator, and my pronouns are she, her, hers.
Hi, everybody. My name is Danae Gonzalez, pronouns she, her, and I am the Business Systems Implementation Specialist at the Department of Early Learning and Care. Okay.
Good afternoon, Chair Miller and council members. I am Whitney O'Connell. I use she, her pronouns, and I'm the Early Learning Business Support Coordinator with DELC.
Awesome. Welcome to all of you.
Thank you. And I know that they have a couple slides that they want to share with you all, so I will.
All right, thanks, Gabby. Yeah, so I was able to kind of introduce myself already. My name is Lindsay Cochran with Business Oregon. I'm new with Business Oregon, started in November. I'm coming from the Research Institute, where I worked did some work with childcare, Central Coordination of Childcare Resource and Referral, and also headed up the Childcare Substitutes of Oregon program. And so when Business Oregon got these funds, I think they were very much looking for someone that had some childcare background. And I'm happy to be at Business Oregon and to share a little bit about this program with you all and yeah, some of the work that we've been doing. So Gabby, can you move to the next slide, please? Okay. So most of you, I'm sure, know House Bill 3005 passed last summer, and it allocated $50 million to establish the Child Care Infrastructure Fund, with the purpose being to provide financial assistance to applicants for activities that promote increased early learning and care capacity across the state. For the 2023-2025 biennium, the funds for this program are coming exclusively from the sale of lottery bonds. So this does limit the fund to physical infrastructure in terms of fixed or capital assets. But, you know, we have heard widely that this is a huge need across the state, and we feel very confident that the 50 million will go quickly, especially knowing the current cost of construction and planning. Business Oregon has been entrusted to collaborate across state government with stakeholders to design and administer this program. And I just want to say I'm just so excited for Business Oregon to finally enter this space, because I think it really helps to bridge that conversation around childcare being an economic development issue. And these funds are really helping businesses to see that in a real tangible way. And then before we move forward, I just want to note that at this point, there are still many decisions to be made around the fund and still some pieces that are up in the air that I think will be ironed out further in the next month or two. But I'll go ahead and share what I can. Gabby, can you move to the next slide, please? Thank you. Okay, so like I said, I started at Business Oregon in November and began working on engaging in public outreach while writing the first draft of the program's administrative rule. So we convened a steering committee to help guide decision-making for the program. The committee is comprised of stakeholders from around the state, including the Children's Institute, First Children's Finance, Ford Family Foundation, Family Forward, Early Learning Hub and CCR and our reps, childcare providers, and others. Business Oregon has also hosted multiple public outreach sessions to gain insight and feedback around how this program will work best in different communities. So this consisted of 2 virtual sessions and 2 in-person sessions in Tillamook and in Burns. And one of the challenges, I think, for this program that's come up has been really balancing the need to go out and get broad public input while at the same time recognizing that we're on a very short timeline here and we know how desperately this money is needed. So we want to start getting the money out as soon as we can. And we are lucky that there have been other grant programs and stakeholders that we can collaborate with to really understand what some of those lessons learned were and how we can design a program that will work for a wide range of applicants and providers. We also want to design a program that is iterative and ensure that we can come back and incorporate changes for continuous quality improvement in the future. So that being said, the first bond sale will take place next month and will be the first 25 million. We're working to make sure that our rules are ready to be submitted so that we can open up applications shortly after that bond sale. So we're anticipating being able to open up applications for the first round of funding in June, and then we'll begin awarding programs in those later summer months. Move to the next slide, please. Okay. Excuse me. So while the bill stipulates that Business Oregon will distribute both grants and loans, this first year will be fully grant-based, and due to the source of funding being lottery bonds. Like I said earlier, we are restricted to funding fixed and immovable assets such as new construction, renovations, repairs, retrofitting, modernization, and property acquisition. One of the concerns that we heard while engaging in public outreach was the need for planning projects, particularly for more rural areas and for tribes. So, you know, this would really allow applicants to apply for money for things like feasibility studies to determine whether they're able to move forward with a particular project. And then they could potentially come back and request more funds in the future. So we are planning on setting aside some money for feasibility studies upfront in this first round in the hopes that those recipients can come back and apply in future rounds as well. It's also important to note that we are not only funding programs that are increasing capacity, although of course that's a big important consideration, but we also want to support existing programs that are struggling to stay open due to much needed repairs and renovations. So we are able to fund both an increase in capacity as well as an increase in quality for programs that are trying to preserve existing slots. Next slide, please. Okay, so the first round will consist of somewhere between $10 and $12 million. Currently, our largest priority is creating an application that is accessible, streamlined, easy to use, in an effort to be as equitable as possible in this process. And we've been really heavily relying on our partners at Children's Institute and at DELC for this work. House Bill 3005 stipulates that we must set aside at least 25% of the funds for culturally specific programs and organizations. We will be using the criteria from the Early Childhood Equity Fund at DELC to determine which programs qualify for that money. And we are hoping that for the first round, we're able to allocate more than 25% for these programs. And we're working closely with Department of Justice right now to determine what that number might be. But I'm optimistic that we'll be able to have a decision on that shortly. Some other prioritization criteria include programs that are expanding or offering infant and toddler care, programs in the most severe childcare deserts, programs that accept subsidies such as ERDC, and programs that offer extended hour care. Those are all listed in the bill, but we also want to consider whether the project meets specific needs of the community. So one of the things we're talking about is potentially having a review for project alignment with the Regional Early Learning Hub's Early Care and Education Sector Plan or something similar. Another consideration we need to pay attention to is that money must be spent within 3 years of the sale of the bond. So we are considering project readiness as well as overall geographic distribution. I think it's important to note that we see the intent of the bill as prioritizing underserved populations, which includes those most rural areas of the state. And I think that due to our need to pay attention to overall project readiness, this is an area where we're really going to be relying heavily on our technical assistance providers. And with that, I'm going to go ahead and pass it over to Whitney and Danae. They're taking the lead on the technical assistance portion of the fund and can speak more to that partnership.
Thank you, Chair Miller and members of the council. My name is Danae Gonzalez, and my colleague Whitney and I are here to share an update around the technical assistance program that DELC is coordinating with Business Oregon to support the applicants and recipients of the Child Care Infrastructure Fund. Prior to us being onboarded at DELC in January, Business Oregon staff and DELC staff had already begun meeting weekly to begin technical assistance planning for CCIF applicants and recipients, as outlined in House Bill 3005. When Whitney and I started at DELC on January 2nd, we have continued to meet weekly with Business Oregon to consult and collaborate around the CCIF technical assistance, the prioritization of funding, and rule development. And I will let Whitney reintroduce herself and share the work that we've done up until now with Business Oregon's CCIF Steering Committee.
Good afternoon. Danae and I are grateful to speak with all of you today on the work being done with House Bill 3005 that supports the infrastructure expansion of early childhood programs across the state of Oregon. As the Early Learning Council may know, there is a substantial allocation of funding set to become available following a bond sale in May of 2024, as Lindsay mentioned. And to ensure equitable distribution and effective utilization of these funds, we've been working with Business Oregon to engage in a steering committee for advising the application and rollout of public funds to providers. Business Oregon is currently in the process of finalizing the rule set, as Lindsay mentioned, that will govern this process. And we anticipate that the application, along with comprehensive guidelines, will be tentatively released in June of 2024. Next slide, please.
As outlined in House Bill 3005, DELC is consulting and collaborating with 2 nonprofit entities that have experience with and are engaged in providing technical assistance for business acumen and operations support, in addition to resources and training to promote childcare facility and capacity expansion. First Children's Finance has actually been providing technical assistance and training to childcare providers in Oregon and has been funded by DELC since 2021. They are a national nonprofit that specializes in providing training, consultation, and coaching directly to childcare providers in multiple languages. They also engage with CCR&R staff to build their business acumen supports for childcare businesses. They have provided technical assistance for the childcare startup and expansion grants that have been offered through the Research Institute at Western Oregon University, also for grantees that applied for capacity building funding through Seeding Justice, and for the Child Care Stabilization Grants. So they've been establishing connections with childcare providers and system partners statewide. We also have an intent to award a regional nonprofit, Northwest Native Chamber, to provide technical assistance for CCIF applicants and recipients statewide. Positive reputation and expertise in providing business acumen support to Native-owned businesses and entrepreneurs through an Indigenous approach to collaborative learning and partnership, but they also provide business technical assistance to all members of the community. Their focus on culturally specific services and business supports will benefit communities that have been historically underserved in accessing the technical assistance supports that are needed to understand, apply for, and utilize the child care infrastructure funds. Next slide, please.
I'm on mute. I'm so sorry. So we want to emphasize that we recognize the importance of providing support to these potential applicants and that we are collaborating with First Children's Finance and Northwest Native Chambers to develop a tailored technical assistance to support those providers with business acumen in preparation for the public funding. So this assistance will be aligned with the application requirements with Business Oregon, and additional TA resources will be developed to cater to the specific needs of selected applicants, which will be provided during the critical year after program startup or expand in order to sustain the investment over time. The goal is to award the funds by the end of summer 2024. And additionally, it's important to note that there is a consideration for allocating 50% of the initial round of grants to culturally specific programs, ensuring that the Child Care Infrastructure Fund reaches and addresses the needs of historically marginalized populations, underrepresented communities, and tribes across the state of Oregon. The availability of this funding presents a significant opportunity to enhance early childhood education across our state. And by working alongside Business Oregon to create a structured application process, it helps to develop the targeted technical assistance alongside First Children's Finance and Northwest Native Chambers and prioritizing cultural inclusivity that will maximize the impact of these funds and positively shape the early learning business supports to programs and the children and families that they serve. Thank you.
Thank you. Thank you, all three of you, for that great update on a very, very exciting program. And I love your time frame that it's like next month, something's going to happen that will be significant and felt in communities. So congratulations on getting this up and running. And what a great partnership between Business Oregon and DELC. So that's exciting to see as well. Questions from council members? Subin.
I don't know if this comment's going to send you down a rabbit hole or if it's helpful, but I know the Early Childhood Equity Fund had a component of having planning grants for people. And I don't know if that's going to be a helpful model of sorts in terms of what that could look like in this, what we were just presented with. And I actually have questions about the equity fund, which I know other than maybe Alyssa can answer, is how successful were those planning grants, right? Did people ultimately end up getting to their goals? Was it the capacity builder that they needed?
Yeah, I think the planning grant model is definitely something we've used. We're using it with suspension expulsion prevention too, right? There's recognizing that readiness is a spectrum and not everybody's in the same place, I think is something that we've really tried to operationalize. On the Early Childhood Equity Fund front, I think we've seen it work really well. And that's why we've tried to replicate that model in some other spaces. But I'll let the infrastructure fund team kind of speak to how that might play into the lottery bond dollars themselves.
Yeah, I think we've been, this was aligning with the Early Childhood Equity Fund is kind of something newer that we've been exploring, and we've met with some of the program coordinators that are working on that program currently, but also the ones that created it. So we've been kind of engaging in that conversation to see like what were the lessons that were learned from that, initial round. What are the things that we have this awesome existing program that we can look back on and say, okay, are there things you would have done differently, and what were those things, so that we can, make sure that we're building on the strengths of the fund. But yeah, it's definitely a continuing conversation and something that we're going to be following up on and building upon.
Okay, thanks, Lindsay. Marie.
I was wondering if the team could speak a little bit to how they see this infrastructure fund impacting or rolling out in any rural communities around the state. What does it look like?
Yeah, I think it depends on the community you're talking to, but that's part of the reason why we knew we could go to 2 in-person events, and we chose Tillamook and Burns. And those were locations that we chose specifically because we know how much of a childcare desert they're in. We know that infrastructure is so desperately needed in those areas. And we also knew from conversations that we had that there are plans that are being made already, and those wheels have been turning in terms of stakeholders in those areas. And so, I see this bill as really calling out the importance of prioritizing underserved populations, one of which being rural communities. And we will be using state childcare data in our prioritization matrix to ensure that that areas that are in the most severe childcare deserts are prioritized with these funds. And I think, that the rollout's going to look differently. There are, I'll speak to Burns specifically. I know that Burns, as well as the tribe, are talking about a joint feasibility study that they're wanting to apply for because they're not quite ready in terms of build out. And so that's something that, we've been working with them on and talking about what would that look like? How can you come and apply for this feasibility study in partnership? And that might potentially result in multiple infrastructure projects down the line, whether they decide to open up a program that is serving both tribal kids and the community, or whether they're going to do that separately. They don't know yet. But it's something that, this initial feasibility study and the ability to have those planning dollars and really make an informed decision before they come back and apply for infrastructure funds is, it's really important. And it's one of the things we've been hearing a lot is that those planning dollars are just really, really needed. And I think initially I know at Business Oregon, we had kind of underestimated how important that was going to be. And that's why that public outreach period has been so crucial, because we just keep hearing again and again how much those planning dollars are needed. And so we were able to go back and kind of say, okay, let's change this up. And if we're going to offer these planning dollars, let's do it up front in this first round so that folks can come back and ask for more.
My follow-up to that for you, Lindsay, that I'm wondering about is how have you all thought about infrastructure with respect to people's homes? As I'm sure most childcare businesses in rural are in people's homes. So center-based care it doesn't really pencil in rural. So I'm just wondering how you're thinking about doing infrastructure in people's homes where the majority of childcare is happening in rural.
Yeah. So in terms of home-based providers, there are a couple different directions that this money can go. So they're able to use the funds for any sort of repairs or renovations that they need done. If they have a roof leak or something else that's preventing them from, offering high quality care, they can come and ask for funds to address those problems. But then also they're able to expand. So those types of costs that startup and expansion through Western, maybe wasn't necessarily able to fund in terms of we're making structural changes here. We are able to do that with these funds, make structural changes, and we're also able to fund, I know that a lot of home-based providers are interested in modular units. So we're able to fund the acquisition of modular units as well. And that's something that a lot of the rural home-based providers were interested in terms of being able to expand their footprint a little bit or switch from an RF to a CF.
I want to add that First Children's Finance, they're already building those small, like the supports for those smaller programs and thinking about how to interact with the funds and developing business plans to prepare them for that.
Sorry, one follow-up to that. Will those be made available in public to others? Those business plans?
So First Children's Finance is contracted to work with all providers.
All right, we need to move on, but I want to thank Lindsay, Danae, and Whitney very much for the presentation and for getting this program up and running and launched. We love seeing things actually on the ground. And I also want to thank our colleague, Katie Brooks, for raising this issue about 2 months ago and saying it'd be great to have an update on this program. And so we appreciate you all being here to give us that update. So we'll look forward to seeing where those projects actually hit the ground. Thank you.
Thank you, Chair Miller and council members.
Yep, thank you. Let's move on then to Gabby, who's going to talk. One of the things council talks about a lot is data and tracking and outcomes. And I think we're all looking for that as we move into this new world with DELC. So Gabby is going to give us a really brief overview of some of the data that's available now. And just know that this is just the beginning of future conversations, council members.
Yeah, thanks, Sue. Appreciate that framing. So council members, you all should might have seen this document in your packet. This is essentially really just me and RUACT wanting to share just some of the existing data dashboards that live within each agency and really kind of just bringing that to your attention. Like Sue mentioned, right, this is really kind of just an introduction. This was also just a preliminary ask, so there might be some others that aren't accounted for, and I'll continue kind of following up and ensuring that you all have just an up-to-date document to where you might be able to find some information that's of interest of you that affects children and families, or is even just related to Raise Up Oregon. So this document is in your packet with the dashboards linked here on the left column. Like Delco recently released their employment-related daycare data dashboard, and really helpful. It even tracks like waitlist numbers, and you can look at it by county. We recently released the childcare licensing division program data as well. So really just wanted to share this with you all to kind of take a look around, and if there's any follow-up questions, to please kind of direct them my way. And happy to kind of carve out some time in a future meeting to see if it makes sense to bring RUAC members or even just someone else from the agency to really kind of just speak about the data or anything that you kind of see here. So you'll see things from, I believe, most agencies, except HEC for the time being. That doesn't mean that there isn't anything that doesn't exist. It just wasn't included in this preliminary list. And then also, oh, and I think you all saw the tracker, so that's great. My second portion was really kind of just to give you all a overview on the Raise Up Oregon implementation tracker and what RUACT is doing to track their progress on implementation. So there you go. Okay. So as you all know, when Raise Up Oregon 2.0 was being developed, each partner agency indicated which actions throughout the plan were current, planned, or aspirational for their agencies. So we're currently tracking all of the actions that the agency indicated were current. There's been some discussion to eventually kind of relook at what was considered planned and aspirational and see if it can be moved into something that's current. But I think that's something that's going to be discussed more further down the line. So what we're requiring, and I do want to preface this by saying that the tracker that I'm going to share is a draft and is likely not going to look like this as time kind of goes on, as we, kind of essentially determine what data is going to be most helpful to really collect. But essentially updates are required monthly by RUAC members or other members of their agency. It's open to them and then they can share it within it. It is internal only, so since it's in draft form, it's not posted anywhere externally. And then here, the bottom two bullets, you'll kind of see where RUAC will really essentially kind of share out their progress to the council. So we're really aiming to share a preliminary report with you all in the fall, so likely around when you all have your October retreat. And then with a anticipated completion date of releasing a progress report in the new year, so sometime February of 2025.
And Gabby, just to put on the record, what's RUAC?
Oh yeah, the Raise Up Oregon Agency Implementation Coordination Team, which is a group that meets monthly. Agency directors kind of selected each of these folks, and we all work on Raise Up Oregon and track the progress on that.
So each of our 6 agency partners have representatives from the management level of their agencies on this team. So I just want to emphasize that this is a super important link and piece in the implementation of Raise Up Oregon. In fact, we probably wouldn't have the plan without RUAC. So I just want to emphasize how important these folks are.
Yeah, thanks, Sue. Appreciate you bringing that up. And then this slide here really kind of just shows what's currently on the tracker, right? The 4, I guess, kind of key questions that we're currently tracking. Again, since it is a draft, it very well could be modified, especially once RUAC really starts updating it. We might find that some of these questions don't really make sense or have to be further defined. But essentially, we're really looking at what are some of your agency's key points of progress to date? Can the council support anything that's needed for implementation? Are you running into any issues or barriers that you're experiencing with the implementation process? And if there's any community involvement in implementing or collaborating with other sector partners or other RUAC members. So we really kind of just want to elevate that and just want to give you all a preview of what the draft kind of tracker looks like. So this is essentially what RUAC members see when they get the alert that it's time for them to also just fill out the tracker. So divided by agency, you'll see the RUAC points of contact here. I put myself here for the council just to kind of track what you all are doing. But essentially, as you kind of hover over each agency, these are each of the actions, and these are all actions pulled from Raise Up Oregon that the agencies had indicated as things that were current. So things that they are already working on. So eventually it'll start being more filled out more, right? But then you'll kind of just see the questions so that they can essentially kind of just input their answers here. And then I will be going through and essentially kind of just sharing that info with you all in the fall as we kind of create that preliminary report with you all. But happy to take any questions. I know it's a lot to kind of take, and each agency obviously went through and indicated different actions, right? I think one thing that I haven't gotten to yet, but I'm sure will also be added is just where that cross sector is in any actions that multiple agencies are currently working on, right? And essentially kind of just highlighting that.
So Gabby, am I correct in saying that if each of us takes Raise Up Oregon, looks at Appendix D, which is the chart of short-term objectives and strategies, page 34 in the plan, that is basically the list of what you just showed us as far as what objectives and strategies they're tracking.
I believe so. I think Appendix D is essentially everything that each agency indicated was current. Yes, I know that I had initially made a list where it was like current and planned, but I do believe Appendix D ended up being just what's current. So
I think so. So council, if you want to get a sense of what is being tracked by RUIAC, look at Appendix D and then see if there's some pieces in there that you are particularly interested in, and let Gabby know that. So, because it's 3 pages of strategy, so they're a lot, but it's the roadmap. So please take advantage of that, and then give Gabby any feedback you might want to. Subin.
I feel like I've taken a lot of space this meeting, but thank you.
It's okay. That's why you were appointed to the council.
Gabby, thanks. I appreciate hearing like the progress, right? Like the story of how things are kind of moving forward. And right now it's a lot of collecting and let's see what we have. And I feel like one of the things that's on the horizon is what narrative can we weave with all this data? So as people are filling out that spreadsheet, what's the story that can be told with all of that data? And I think that's something that would benefit the council greatly. I think another thing in there is I didn't see, and maybe you guys have already talked about this and thought about this, but I think the conventional term is KPI. Like, what are the performance indicators that we're going to hang our hat on and say, these are the things that if we're successful, this will happen. So for the infrastructure fund we just heard, it's probably related to dollars rolling out, program supported, numbers of program or buildings created, whatever it is, right? I'm not nailing it, but like there's going to be different performance indicators for different elements. And that's where I think it gets really unwieldy because you have so many initiatives in DELC. And so I hold both of those comments hand in hand, the data narrative plus those KPIs. And what grain level do you think needs to be presented to the council? And is there a way for us to drill in, right? So like if we get a big picture sort of data dashboard, that's the thing we check every, now and then, but we want to drill into a specific program or an initiative. Is there a way for us to do that? So I pose those questions as you go forth.
Okay,
thanks,
great question, Subin. Yeah. Okay, Gabby, thank you for tracking that, and thanks for all that you do to pull RUIAC together. I know you're a very key supporter of their work. So, thanks. Let's move then to the Child Care and Development Fund, fondly known as CCDF, which I think everyone knows provides a lot of funding that Alyssa gets to play with. So this is a very near and dear topic for all of us. And Jordan, we're delighted to have you back with us again. So welcome, and we appreciate the update. And Council, when Jordan and I talked earlier, I said what we're really going to be interested in is, how is DELC currently situated with the updates that are required by the feds, and where are the pieces that DELC's going to have to change in order to be in compliance? So Jordan,
yes,
take it away.
Thank you, Chair Miller, and thank you, Council, for having us today. Once again, my name is Jordan Pargetter. I'm the Child Care Development Fund Administrator here at DELC. And yeah, I just have a few updates to share with you. I know I was here last month also, so it won't take too much of your time. I know you have a jam-packed agenda, but I did want to touch base on just some of the work that's going on around our federal funding, the Child Care Development Fund. And I think we can go ahead and go to the next slide. You all are more than aware of this, but the Child Care Development Fund is a federal grant that we get from the Administration for Children and Families. DELC is now the lead agency as of July 1st, 2023. As you can see here on the slide, there are lots of different things that we do with our CCDF funding, including direct services to families predominantly, but also quality improvement and professional development supports. And I think we can go ahead and go to the next slide as well. Thanks, Gabby. I did want to touch base around our state plan. I know I spoke about this last month, but I did want to just give a heads up of sort of where things are at. So every 3 years, lead agencies have to reapply for their federal funds, and this is called our CCDF state plan. We often try to clarify that, unfortunately, this isn't an incredibly aspirational document, but it is a reflection of our current state policies and processes and how they meet federal requirements. And so we've been working pretty diligently across our agency and across different agencies to make sure that we complete this document. And we will have that ready actually for public comment on May 1st. And so I wanted to let this group know in advance as well to be looking out for that. That'll be going out via email as well, but we'll have that posted on our website on May 1st again, and that will be available for public comment through June 7th, and we'll be holding a public hearing on June 5th. Okay, and then these next few slides here are just going over kind of the new state plan draft and some of the different sections because it's different than how it's been in the past in terms of its organization and content. So it'll be fairly quick. I'll just kind of run through what's in the state plan this time. And you can go to the next page. So this has, as you can see, all 10 sections. There used to be 8, but this kind of goes through everything that DELC has to answer for to the federal government, ranging from CCDF administration and leadership to how we're supporting families' eligibility and enrollment and their access to care. It also covers childcare affordability, parental choice, how we pay providers and what those payment rates are, health and safety of childcare settings, skilled workforce supports, quality improvement activities, some of the coordination efforts and partnerships across agencies and organizations to support service delivery, family outreach and consumer education, which is basically information that's available transparently to the public on our website. And then program integrity and accountability. And then that last piece that you can see there in Appendix 1 is something called the Lead Agency Implementation Plan, and I'll talk about that in just a minute. So for the state plan itself, for this next cycle, as I mentioned, we do have to have a public hearing, and that's part of a federal requirement. So our draft CCDF state plan will be available May 1st through June 7th on our website and available for public comment during that time. I actually need to update this slide, but I'll get you the updated slides. We actually are creating a separate email address that people can go ahead and email in their comments. And there's also a fillable form that they can use that we're able to track comments more efficiently, but I'll make sure that you get that on here as well. In addition, we're holding some information session webinars to kind of go over the content on a high level of what's available within the state plan. And then we'll also be hosting a public hearing, as I mentioned, on June 5th. I think we can go to the next slide. Okay, so this is the real meat and potatoes, I guess, of why I'm here, which is that I know I mentioned last month that there had been some significant changes to the Child Care Development Block Grant Act and some of the federal requirements around the use of CCDF. And so those changes go into effect April 30th, and lead agencies have until June 30th to implement them unless they request a waiver, which would extend that out 2 years from the effective date. So it puts it at the end of April 2026. I think we can go to the next slide. So this was that timeline I was sort of just talking about this past summer. The Office of Child Care released a notice of proposed rulemaking that they were considering making changes to CCDF, and they opened that for public comment. And then in late February, early March is when they initially made the announcement that they would be publishing the final rule, and it has an effective date again of April 30th. We have been conducting our analysis on DELC's end just to figure out what might be necessary in order to come into compliance with these new requirements and also some of these optional and encouraged changes. And as I mentioned, June 30th is that required implementation date. It's coming up very swiftly, but states can also request a 2-year delayed waiver for required policy elements. And I'll get into those on the next slides. This one is just an overview. I think I spoke about this last month, but it just goes over the goals of kind of the CCDF rule revision, which caps copays. It revises payment practices for providers and also encourages online applications for CCDF. Those are sort of the really high level pieces. And I think we can go to the next slide. Okay. So for DELC, as we've been going through our analysis, I do want to mention that analysis is ongoing, especially in regards to like budget and fiscal analysis and what it will take financially in order to come into these areas of compliance. But I do want to go through the different areas in which we know that we're in compliance versus areas where we have some work to do. So out of the required changes that are outlined within the final rule, we are in compliance with 4 of them, and I have them outlined here. So Oregon already capped our copays at no more than 7% of a family's income with the passage of House Bill 3073. So we have that in our statute, although now that's federally required and it's no longer just an encouraged benchmark. Lead agencies have to have an online subsidy application. Again, a lot of states don't have this in place, and with the one application system with other programs, ERDC does have this in place already. And then the second 2 here are just around some of our background check policies that were already in place for Oregon. And so we don't have to make any changes around those areas. And then we can go ahead and go to the next slide. Thanks, Gabby. We have a couple areas where we're currently in process and are hoping that we can meet that June 30th date. So the first one here is around the market rate study that's collected every 2 years, needing to collect data around providers that charge higher than families' copay amounts. So you may hear that as like a parent amount, where they're charging beyond subsidy and beyond a parent's copay. And then the second one here is just that we have to have aggregate data posted online for the total number of children in care by provider type. This is a change from current state, which requires us to collect that data and post it around serious injuries and deaths, which we are in compliance on. And you can go to the next one.
Jordan, quick question.
Yeah.
Where would that be posted?
It's posted on our website within the safety portal page. I can give you the specific link because it's not by provider. So it's listed kind of as like a more of a snapshot of all of our providers. And so I can provide that link if that's helpful.
Okay, sure. That'd be great. Thank you.
Yeah, of course. This next page here is all around the areas where we're not in compliance. I do also want to note that some of these areas we are in partial compliance for. It's just that with the release of the new final rule, we realized that we weren't fully meeting the intent of the rule. And so there's some work that we need to do as a state to kind of come into full compliance. And so the first one that we're not in compliance on requires us to have 12-month eligibility for subsidy for new children in the household in the middle of the certification. So an example of this would be if a family already has ERDC and then they have a newborn in the middle of their certification period. Current state, we would just add that child onto the case. They would continue on the case until they recertify, and then we would recertify the family altogether at that year mark. What this specifies within the final rule is that that newborn actually has to have 12 months of childcare subsidy eligibility on their own. And so we're doing some work, the childcare assistance team especially is doing some work around the one system and what it would take in order to be able to do that, and also to align childcare services for the whole family. And so something that we're looking at present is the ability to extend out those certifications in the event that there's a new child in the household. So just extend the whole family's certification out a year. So that's the first one. The second one here is one where we are partially in compliance. Lead agencies must offer grants and contracts for direct services for 3 specified populations. So infants and toddlers, we already have in place with Baby Promise, and that's an area where we can look at potentially expanding. We also have to have grants and contracts in places for children with disabilities. We do have some additional dollars that go from the Inclusive Partners program to help support children with special needs and with disabilities and really support providers in those areas, but those aren't contracted slots and we're aware of that. And so that's something that we'll be doing some analysis on going further. And then also in geographically underserved areas. So DELC is just continuing kind of our analysis on what it would take in order to meet that requirement. The next one here is that lead agencies must pay providers based on enrollment and not attendance. And you can see the asterisk there as well. Oregon has moved very much toward paying based on enrollment, but because of the provider payment system that we still have in place, there is still the requirement that providers are billing on a monthly basis for the hours that a child is scheduled to attend. And so there is still that attendance piece that's linked over to their payment. And so that's an area where we know that we'll need to make changes. And so with the release of the provider management platform, that's something that we're hoping to be able to address at that time. Likewise, this next one here says that lead agencies must pay providers prospectively prior to services being delivered. And this, again, is an area that Oregon has made progress on in the form that we've been able to pay or, to allow providers to bill at the beginning of the month. However, they're not receiving payment before their services are being delivered. They're sending in their billing forms, and then that takes processing time in order for that to be paid out. And so that's another area that, because of the system that we have at present, that's an area where we would need to make changes in the future. The next one here really is around providers receiving notice of changes to families' eligibility statuses. So things like receiving notice at the end of a family's eligibility period that they'll be losing eligibility potentially, or if their case closes in the middle of their eligibility period, or if there's another child that's added onto the case. Those types of things where right now we do have some notices that are going out, but from what I've heard through conversation, they're not always consistent. And so that's an area where more work will be needed in order to revise that. And then the last one here is just that lead agencies may only apply provisional approvals for childcare staff when there is a fingerprinted background check on file. And that's an area that we've known about for a while that we're working toward, but this is something where right now Oregon does allow provisional approvals with supervised access to children while we're waiting on those fingerprinted background checks, already having done in-state background checks and checks. But at this point, that's an area that we'll also need to be revising. So those are all of the areas that we have some work to do on. Are there any questions before we move forward?
Any questions?
Just a question. So what is the HC going to do? Are we asking for a waiver? Or are we going to try to be in compliance by April 30th, or what's our status?
Right. So we actually just today received notice about how to request waivers from ACF. They hadn't sent out any sort of guidance to states on what the next steps were. And so we do intend to request waivers. I'm not sure specifically about which ones we will be requesting waivers on. What I would say is that, especially these ones that will require system changes, those do tend to take a while. So I think any of the things that require technological or systems changes will be ones that we'll likely have to request a waiver for. And that would allow us through April 30th, 2026.
Okay. Okay. Next.
Okay, we can go to the next slide, Gabby. Thank you. These are just some optional changes. They're not required for the final rule, but they do open up some options for lead agencies that weren't previously available, which is mostly that families, this is a clarification, that families may utilize childcare for activities outside of their initial qualifying activities. That's one area that Oregon is already in full compliance for. Once a family is eligible, we're not monitoring how they use their childcare hours after that point, as long as they were eligible during that time. And then there's also an allowance for lead agencies to pay providers higher than the rate that's charged for private pay families. That's an area where we do not currently have that in our rule set. Providers are allowed to charge higher for quality purposes or if they are scholarshiping families, but that's an area where we would be making a change potentially. And then the next one here is just a change in the allowance of waiving copays. Right now, or previously, states could waive copays up to 100% of a family's income, waive copays if a family had income less than 100% of the federal poverty level. And now that's raised to 150%. And then they also added in some additional populations, such as those involved with child welfare, those experiencing houselessness, et cetera. This next one is around flexibility for presumptive eligibility, which means that essentially that families would be determined eligible for a 3-month time frame automatically, and that then they would have time to submit the rest of their verification. This is an area where I'm not sure if Oregon would qualify for this, just because we've been working on increasing our accuracy and reducing our error rate. And that was something that was put into the final rule that might not be an option for states that are currently working on that. And then the last piece here is just shared documentation sources across state agencies. Obviously, we have the one eligibility system, and we do share documentation across many programs, but obviously there are other programs and agencies that we don't share documentation for. So those are all optional.
And if it's okay, I just want to add one caveat. While they did give states in some of these areas additional flexibility, they didn't necessarily give us much money to take advantage of any of the flexibility, right? So we are still, was a little bit new money in the new CCF allocation, but actually very, very small. And almost most of these changes do have fiscal impacts associated with them. So that's just the reality of that constraint alongside with the formal rule flexibility. There's not necessarily the resources to take advantage of them.
Thanks, David. That's an important clarification.
Yeah, not unique, I'm afraid. Liz.
And so I just wanted to, on the optional changes, the second one, just kind of, I think, elevate that this in particular is really challenging for providers that have private pay families that are coming in just above those income limitations, because they're needing to charge as much as they can to recover all of the ERDC funds. But that means that they're needing to price private pay families often out of being able to access that service. And so I would just encourage, if there's an opportunity to opt into that, I know that our local providers struggle with this, trying to meet private payers where they are while also maximizing what they're getting from paid slots. So I just wanted to sort of put that on your radar. The other question I had, and this might be more towards David, but just for my own edification, could you maybe break down just real in high level terms, one of the things that several of these council members have been talking about is how we get the rural rate up, basically. And what I'm curious about is the ERDC funds, are they all federal funds, or is ERDC funded from a mix of state and, like if ultimately the goal is to get those rural rates up, is it our federal lawmakers we need to be talking to actually meet that? I wasn't sure what the blend of funding is to provide.
Yeah, and I apologize because this is the I'm gonna give an overly complicated answer because it really is an overly complicated piece. So it is, so on the funding level, it is both state dollars and federal dollars. However, that sort of pot is subject to those federal rules. And when it comes to rate setting, there are kind of multiple pieces to rate setting. There's both the federal regulations that we have to follow, And those include, unless we make the translation to alternative rate methodology, looking at market rates, looking at how they vary across geography, ages, and provider types, although I think even with alternative rate methodology, you still have to look at those. And then the other addition is that provides the frame, and within that frame, rates are a mandatory subject of collective bargaining with the unions that represent childcare providers, so AFSCME for the family childcare, licensed family childcare providers. So in the end, the rates are set through that collective bargaining agreement.
Thank you, David, I think. You did warn us it was complex. Okay, another quick question, and then we need to move on to rulemaking. Robin.
Thank you. As you know, I've been talking about and thinking about and asking questions about this for a while, and I always learn a little bit more from all of you. So when I was just listening to you, David, then I had a new aha question. Aha. I understood that the union had to be involved with rate setting, but the nuance then that I'm grappling with right now is, if you eliminate a category, which is 2 rates, because right now we have 2 rates, if you eliminate a rate, do they have to be consulted with? Do they have to be a part of that bargaining? Because you're really not changing a rate. You're just saying everyone's going to have this rate. I don't know. I had a new question for the first time. Sorry.
You're on mute, David.
Of course, I did that. All of the rates are subject to the collective bargaining agreement. So, and it is also a federal requirement of how you explain how your rates are reflecting differences in prices across geography.
But then in follow up to that, does the federal ERDC mandate that there is a rural and an urban difference, or?
So you do have to show how your rates are reflective of the difference in prices across the state. So that is something that you have to show that it is part of your rate setting.
Thank you.
But follow up to that, I think, is that I've certainly heard Robin in other meetings say it's just as expensive to provide childcare in rural areas as in urban areas for a variety of factors. In which case you wouldn't have to have 2 different rates, right? You just say the expenses are the same.
Between looking at prices and looking at the cost of care. So alternative rate methodology also allows you to look at the cost of providing care, right? But I think it's also important they're answering 2 different policy questions, right? Because part of what the rates do is provide access to families so one way to think about the market rate study and what states have been asked to do with that is it says, we want you to line up all your child care providers by price in each of your communities. And with the rate that you set, the benchmark is, can a family choose 75% of those providers in the community? So there's an access piece that's associated with the rates and looking at market rates. There's also a policy question around, are we paying providers adequately to do the work that we're asking them to do? And that transition to being able to also look at cost of care in addition to the rates in the community is an effort to also address that policy question.
Got it. Of course, nothing is straightforward or simple. Okay, thank you, David. We appreciate that. We've got to move on or we're not going to get to our rulemaking. Jordan, thank you very, very much for coming back to us, and it sounds like we'll see you again sometime.
Oh yeah, I'm sure you will. Thank you so much for having me. Take care.
Thank you, Jordan. Let's move then to the rulemaking. Chris, are you going to lead this off?
Yes, good afternoon, Chair Miller and council members. We are going to head into rulemaking. So the first thing that we will do today in rulemaking is we will have the council vote on 3 repeals, and then we will go into presentation on the CCR&R match. So at our last presentation, we gave some information on the rules audit we did in fall of 2023 as an agency and rule repeals that we needed to do. That background information was also included in the materials for this Early Learning Council meeting. But just so that we don't have to go through all of the background again, we just wanted to elevate that we had no public comment on these suggested and proposed repeals for the 3 program rule sets. Gabby, can you go to the next slide, please? And the need for these repeals is that we no longer as an agency are administering any of these programs. So as a result of the rules audit, we are bringing them forward to be repealed for just some routine rules cleanup. So the first set of rules that we're bringing forward for repeal is the Child Care Contribution Tax Credit Program.
All right, thanks, Chris. Are there any questions about this one based on what was in our packets? If not, I've asked Katie if she would just put these motions on the table. So will you do the tax credit one, Katie?
Sure. I move to repeal the following rule set dated April 24th, 2024, that repeals Oregon Administrative Rules 414-700-0000 through 414-700-0060.
Thank you. Is there a second for that?
Seconded.
Thank you, Barry. Any discussion? Hearing none, all those in favor, please say aye or raise your hand.
Aye.
Aye. Any opposed? Any abstaining? All right, thank you. Motion carries unanimously. Next one. So Katie, will you put the next motion before us?
Sure. I didn't know if you wanted to go into it or not. It's Dependent Care Planning and Development Program Rule Set Repeal. So I move to repeal the following rule set dated April 24th, 2024, that repeals Oregon Administrative Rules 414-100-0000 through 414-100-0020.
Thank you. Is there a second for that motion?
Second.
Thank you, Robin. Any questions or discussion based on what was in our council packet? Hearing none. Those in favor, please say aye or raise your hands.
Aye.
Aye.
Aye. Any opposed? Any abstentions? Okay, motion passes unanimously. Thank you. And the final repeal, Katie.
Yes, it's Migrant and Seasonal Farm Worker Child Care Program Rule Set Repeal. I move to repeal the following rule set dated April 24th, 2024, that repeals Oregon Administrative Rules 414-400-0000 through 414-400-0100.
There's a second for that.
I second.
Thank you, Subin. Any discussion, questions? Hearing none, those in favor of the repeal, please say aye or raise your hand.
Aye.
Aye.
Aye. Any opposed to the repeal? Any abstentions? All right, thank you. The motion passes unanimously. Thank you, Chris, and Katie, thank you for putting those on the table. So now we're going to go to a briefing on the CCR&R match requirement. And as you know, Council, we're not voting on this today. This will be on our next Council agenda in May for action. But Margie McNabb, whom many of us have worked with for a while, years, is here to present information on this. So Margie, welcome. Good to have you with us.
Thank you so much. Good to see you, Chair Miller and ELC members. It's always nice to see familiar faces. For the record, I'm Margie McNabb, Child Care Resource and Referral Coordinator in the DELC PLSO team. And I work very closely with the CCR&Rs. And what I'd like to do today is obviously present on some rule changes based on statute language changes in 2019. And I wanted to start by just reminding everyone of the purpose of the CCR&Rs and also other entities that will be considered part of the CCR&R network. So our child care resource and referral agencies are the professional associations for early learning and care mixed delivery system. We have 15 CCR&Rs in Oregon, and in each region, they provide the following services. They recruit more early learning and care programs to meet the needs of their communities. They also provide professional development through trainings, consultations, coaching, and resources for our early educators. And they promote retention to sustain the early care and education field through the training plus cohorts and networks that support them. And they also collaborate with the early learning hubs and other early learning community partners to comprehensively support each region's families, young children, and early educators. And also this year, the CCR&R system in Oregon is 35 years old. So we definitely have a celebration of CCR&Rs. So next slide, please, Gabby. The other DELC funded programs that meet the changed CCR&R definitions are 211 Info. They provide childcare referrals. Also, our PSU Oregon Registry, they are the career lattice, and they provide professional development and training for our childcare workforce. And those strategies are professional development and retention. And then the Research Institute at Western Oregon University Central Coordination provides professional development for the overall CCR&R system through universal, targeted, and intensive training and technical assistance. And these are recruitment, retention, and professional development strategies. Next slide, please. Thank you, Gabby. I'd like to share a bit of a timeline just to give some background on what all has been happening with match requirements for our CCR&R entities. So prior to 2019, CCR&Rs were required to have a match, and that was in statute and rule, and it was between 10 and 20%. Most recently, several years now, it was 10% until 2019. During the 2019 legislative session, there were some statutory changes which moved the percentage of the match to rule for the Early Learning Council to decide on what that percentage would be. And then the match requirements applied to all entities in the CCR&R network because the definition of CCR&Rs changed. There was just one word change. The list of strategies and the definitions of what CCR&Rs do had an and in it and changed to or. So all agencies that provide any of those services in the definitions would be considered within the CCR&R network. And that one of the reasons for that change is because 211 Info started doing childcare referrals. So that's it, and it shifted from the CCR&Rs and doing it. And then, in March of 2024, we started the process of the rule change to match statute. And we formed a rulemaking advisory committee, which included 4 CCR&R directors, child care providers, and some community-based organization representatives. We had one RAC meeting in March of 2024, and we received a lot of excellent feedback, comments, suggestions, and also questions. And I'll be sharing that with you in the next slide. So in this timeline, we had a public hearing April 22nd, and we had 2 people show but no comments. And then public comment ends April 30th. And then in our May meeting, as Chair Miller said, we will be moving forward to vote on and adopt the new Oregon administrative rules with this language. We would expect that the match requirement would start in the next biennium, starting July 1st, 2025. Next slide, please. Thank you, Gabby. So here are some of the concerns from the Rulemaking Advisory Committee. They were asking to define pass-through funds, and we added that definition to the rule. Also, to define what is approved for in-kind donations to be a match, we added that definition. They're concerned that 10% match is burdensome and did request a lower percentage of 1% to 2%. And talking within our PLSO team, we're concerned about going lower than 10%, given the requirements of other contracts, DELC-funded contracts, which include 20 to 25% match. They also asked for a definition of core services and what funds are required to be matched. We added that definition. And then the options used for match pre-COVID are no longer available. And an example of that is pre-COVID, trainings for our early educators were held in person. And oftentimes rental space was waived, and that was an in-kind donation. Now we have a different world, and many of the trainings are virtual. And also for those that are in person, the landlords of the rental space really can't provide as much of waived fees as they used to. They just don't have the ability to do that. So that's one example of a match that's going to be difficult to use. So we met with our grants team and talked through what some possible options would be in this new world. And they are more than willing to provide some technical assistance sessions prior to the next biennium to help identify new match options, as well as, other kinds of match too. So next slide, please. So here's the language for the definitions in 414-500-0020. And you will see that the red words, the red phrases are the additions and changes. So core services are create and maintain a database on provider supply. And as I believe you all know, it's Find Childcare Oregon, and CCR&Rs update that. And 211 uses it for referrals. Provide consumer education, consultation, and referrals. Encourage the development of childcare resources and provide ongoing training and technical assistance to providers. The addition of training came from the RAC, believing that it gave a bit more information on the comprehensiveness of the services CCR&Rs provide. Provide technical assistance to employers. And then here's the change from previous statute language. It did say and now it says or, and then record, analyze, and report data on requests for services. And then these definitions 10 through 13 were added, again, based on the RAC feedback. So pass-through funds are funds which the department passes through to the CCR&R under a grant or contract to distribute to a child care provider, government entity, private organization, or nonprofit in the form of a grant to provide services for the early learning system. An example of that right now is Baby Promise. Core services funds are funds that the department pays to the CCR&R, which the CCR&R uses to provide or cover the costs of core services that serve the general population and not targeted to a specific group as outlined in OAR 414-500-00203A through E.
Margie,
Again,
excuse me. I'm
Yeah.
going to interrupt you because we only have 9 minutes left.
Oh, okay.
So I think we've read these because they were in our
good.
packets.
That's right. That's
so we've got to move pretty quickly here.
Okay. So here's the addition to the definition or the match. It was adding equal to 10%, and then also the phrase core services funds. So that's the clarity of what funds will be matched, and those were provided in the definitions. And then the final slide is justification for 10% match. So just quickly going over, 10% has been consistent for several years prior to COVID-19. Also, requiring a match promotes diversified funding streams and encourages community investment. And CCR&Rs have received funds for additional direct services. However, they have not received increased funds to support infrastructure inflationary adjustment. And they also primarily provide direct services to our early educators and community collaboration efforts. Backbones at one point could support more in kind through administration cuts, but that's not always the case now.
Right.
Any questions?
Okay, thanks, Margie. Questions of Margie on any of this? So it won't be new for CCR&Rs. It's just putting this in statute, basically, and they will need to find new ways of providing that match. So, but as Margie said, DELC staff is ready to work with them on that. All right. Oh, Robin, sorry.
Thank you, Sue. I think my question maybe is a follow-up. It would be helpful to know, there's other programs that require a match, and so I can only imagine it would be helpful to see what other programs require a match. And so DELC would know better than I would what was appropriate. And so I just don't feel like I have enough information, but you know what you need. And so I'm supportive of that. That's helpful.
So, go ahead.
Go ahead. Go on, Margie.
Oh, I was going to say, I do know early learning hubs are 20%, and I believe relief nurses are 25%. And those are just off the top of my head right now.
Yeah, so it's not across the board. Not all of the programs that are administered by DELC have a match, but just a handful of them. So then that's interesting too. And it must be challenging for them to understand that. There must be reasoning behind the differences.
And I guess I could call on David or John as far as, I don't know the rest of the matches. I would have to look them up. I do know, for example, our Preschool Promise and OPK would not have matches that I know of. I could be wrong about that.
I believe though actually part of the federal Head Start though is a match, right? So I think Preschool Promise is one of the exceptions for not having a match, but I think in some sense that's because we're often sort of purchasing a slot in a classroom, for Preschool Promise. So it's a little bit of a different model.
Okay, Ruby.
Hi, thanks. Curious if there are considerations or factors affecting organizations that maybe serve both as the Early Learning Hub and the R&R, or a combination of other programs that do require a match. So for example, an organization that is a hub and a CCR&R, their match is going to be, they're going to have to come up with a lot of funding to be able to serve as those two partners in this work. So I'm just curious if there's any thoughts or considerations around that.
Well, in the shared backbones, they're still very separate, and the hub has had to have a match for all this time, so they're already set. What I do know is that at this point in time, not just the shared backbones, but in other regions, oftentimes the hub is helping support the CCR&R in some way through some activity. So I know that's already happening. And so there would be that consideration, but you're right that where they share the backbone is going to have to help now with the CCR&R in identifying a 10% match. And I think that would be another area of TA that DELC will provide for these, specifically around the shared backbones.
Okay, thanks, Margie. And Ruby, thanks for the question. All right, we are going to wrap up this meeting. Margie, thank you very much. We will see you in May.
Yes, thank you. Good to see everyone. Bye.
Appreciate all your work with the CCR&Rs, Margie.
Thanks. Sue, before we move on, just want to make sure, I might have missed it, but there was no public testimony submitted or request to provide any verbal testimony today. Just wanted to flag.
Thank you, Gabby. So Council, May, our focus is going to be on housing. Gabby and I had a great conversation with Director Bell, who's head of the Housing and Community Services Department earlier this week, and she is going to put together a presentation with her staff for the beginning of the meeting. As our pattern, we'll have a community panel following Director Bell's presentation. And then from 11 to 12, we will ask our agency partners to focus on the role of housing in their own agencies, because obviously it's foundational to everybody and everything. So that will be May. That's also virtual. And then in June, just a reminder that we're going to meet in person in Salem at the DELC office, and that focus will be on hubs. So, and for those of us and you coming in from out of town, we'll do, another one of those pre-meeting dinners the Tuesday night before the council meeting in June. So I'd encourage any of you who can come in by 6 o'clock in time to just have some social hour time. Any final comments, questions from anybody?
There was a question from Marie Sue in the chat if the June meeting will still be, if there will be Zoom available, and yes, so it'll be hybrid, in-person preferred, but there will be a Zoom meeting available for anybody who needs it.
Yeah, thanks for the question. All right, thank you, everybody. Quite a productive, substantive meeting, and there will certainly be follow-up for it. Gabby, thank you again for pulling all this together. Okay, take care. Have a great afternoon.